Before we start, I would like to remind you all to press the big button in front of your microphone if you wish to speak. There will be a green light on your microphone once you've pressed it. And when it's time to deliver your intervention, please wait to speak until the light on your microphone turns red. Please also speak slowly and clearly into the microphone. This is very important for our interpreters. Thank you very much. And before we resume the rest of the agenda, draft resolutions have been uploaded on the Regional Committee web portal. If any member state would like to submit an amendment to a particular draft resolution following our discussions of the agenda items, please submit your suggested amendment by email to RCM email address. In suggesting an amendment, please use precise language. And distinguished representatives, I was informed that Ms. Francisca Fuentes from France will not be able to complete her term as French rapporteur. I was advised by the legal counsel that, in such case, a new French rapporteur should be elected in accordance with Rule 10. I understand that France would like to nominate Ms. Ines Ferrer as French rapporteur. Unless there are other proposals, may I take it that this nomination is agreeable to the committee? I see no objections. It is so decided. Thank you very much and congratulations, Ms. Ferrer. With that, we will move to the next agenda item. We will now move to begin our consideration of agenda item 16, specifically 16.1. 14th General Program of Work, Results Framework and Investment, document WPR/RC74/10. May I call on Dr. Susanna Jacob, Acting Regional Director, to introduce this item. Dr. Jacob.
Thank you very much, Mr. Chair. Good morning, ladies and gentlemen. First of all, I am very pleased to present to you WEPRO RC74/10 document on the coordination of the work of the World Health Assembly Executive Board and the Regional Committee. And this working document contains several items, altogether 7 items. And today, now we will consider item 16.1, the GPW, the result framework and the investment round. Then later on today, we will also consider 16.6 on the rules of procedure of the Regional Committee for the Western Pacific. And we will also consider item 16.4 on the WHO transformation in the Western Pacific region. Then Thursday, that is tomorrow, we will consider item 16.3 on WHO's work in the countries, and also 16.5, which covers the items recommended by the World Health Assembly and the Executive Board. And then finally on Friday, we move to 16.2 on the agenda of the 75th session of the Regional Committee. So, ladies and gentlemen, this takes me to the item that is under consideration now, which is 16.1, 14th General Program of Work, Result Framework and Investment Round. And it is my pleasure to introduce this item to you, which is very important. As you may know, the WHO General Program of Work, or GPW, is a strategic document that sets out high-level roadmap and agenda for global health. The GPW outlines the organization's priorities and objectives for a specified period. Building on the strength of the GPW 13 and covering the period from 25-28, the broad goal proposed for GPW 14 is to promote, provide, and protect the health and well-being of all people everywhere. To realize this overarching goal and to deliver on the strategic objectives of GPW 14, adequate financing of the WHO budget for the period 25-28 will be essential. The first WHO investment round aims to cover the voluntary contribution requirements of the technical programs of the base segment of the respective program budgets for 25-28. In addition, as we know that accountability is so important for our member states, we also need to ensure that we have an optimized result framework and innovative ways of working to be able to effectively deliver on the ambitious agenda, but also report back regularly to you on implementation and ensuring that we have sufficient impact and result in the countries. So therefore, these three items are connected on the agenda. You may recall that we also organized a briefing for the member states on these items earlier on, but now it is important to consider it also in the formal agenda of the RC. And to provide further insights on the interlinkages of the 14th General Program of Work and the investment round and result framework, with the permission of our chair, I would like to invite now Mr. Imre Holló, Director of Planning, Resource Coordination and Performance Monitoring, as well as Ms. Lynn Möhlenberg, Acting Director, Strategic Engagement from WHO headquarters in Geneva to deliver the presentations. Thank you, Chair. Over to you, Imre and Lynn.
Thank you very much, Acting RD. So I would like to start. Can we have the presentation up, please? Next slide, please. I would like to start with a summary slide that tries to capture the paper that has been provided to you as one of the background documents for the regional committee. The acting regional director asked us to explain the interlinkages among these three agenda items that are presented to member states in different fora, sometimes in separate as separate items, because the GPW 14, the investment round, and the results framework hang together very closely, and in a way they are part of one complex package. In the core of everything, and that's what you see in the middle, is the GPW 14, which, as Zsuzsanna said, is the WHO's medium strategy. What is also important to note is that this is a member state document. So this is a strategy that member states own and approve and then guides WHO's program budgets and WHO's operations in the period that it encompasses. The results framework that you see on the right and is the core of the GPW, in a sense that it includes the outcomes, which are the joint responsibilities of the Secretariat and the member states, and the outputs, which are the Secretariat's contribution to the outcomes, and the measurement framework, which is obviously measuring how successful we are in achieving these outputs and outcomes. And on the left-hand side, we try to explain a little bit what the investment, how the investment round connects to that. So the GPW 14 is going to encompass three program budgets, 24-25, but only the year 25, 26-27, and 28-29, but only the year 29. And every program budget consists of assessed contribution and voluntary contribution. And the focus of the investment round is the voluntary contribution part of the base segment of these underlying program budgets. And my colleague Lynn will talk about that further. So we just wanted to, it's not overly complicated in a way, but we wanted you to see everything together. So the GPW, in a way, is the content, which is basically the driving the program budgets underneath, and obviously the measurement framework that's attached to that. So when you hear these three agenda items, make sure that you understand these interlinkages, and we hope with that short paper we could contribute to that understanding. So I will talk about the GPW 14, and then Lynn will talk about the investment round. Next, please. Next, please. So, as the acting RD said, we already had a more detailed presentation. So I'm just going to be, I'll give you a quick summary of where we are with the GPW 14 development. And the starting point is that the world has changed since GPW 13, and there are a couple of evolving themes that shape the creation of GPW 14. One is a completely and rapidly changing global environment where climate, demographic, and epidemiologic and other changes are becoming even more pronounced, increasing health emergency risks. Health systems in many countries have suffered, and there's a clearly escalating demand for health. The overall health ecosystem has changed, and there are even more players and new regional institutions and even international financing institutions and instruments at play, which need to be reflected at GPW 14. And lastly, WHO itself is changing and needs to change. It has to be better equipped to coordinate and play a leading role in that evolving new ecosystem. It has to have a more prominent position. We have to continue the path of further strengthening our focus on country and regional capabilities, and we talked about that already with the program budget 24-25, that focusing on delivering impact in countries is paramount. And of course, we need to be more efficient, we need to be more agile, and we need to be more responsive, and all this should be reflected in the new GPW 14. Next, please. Many people ask why now, because we already have a GPW 13 that has just been extended and is going until 2025. And to be quite simple and honest, the only reason why we're starting with the GPW 14 now, and there's this overlap in 25, so the new GPW starts in 25 and GPW 13 ends in 25, is because of the investment round. The investment round, it was proposed to take place or cover the period of 25-28 if the executive board in January gives the final green light to that. And we needed the content and the strategy that underpins that investment round, and that was the key driver for bringing the GPW 14 preparations a year earlier, and that was also reflected in the decision this May at the World Health Assembly, which asked us to start the preparations to underpin the WHO investment round. Next, please. Next. So can you just click through, because I think there's a lot of animation here, but we don't need that. So I just want to say that one of the lessons learned from GPW 13 was that we need more consultation and more engagement, both internally in the Secretariat and also with member states and other partners. So we had set out quite an ambitious agenda of consultations and briefings and discussions again, both internally and externally. For the first time, at least in my memory, we also involved partners, key health players from other fields, and we shared the draft with them, and we had a meeting with them soliciting for their inputs, and this continues. We will have our next member state briefing in Geneva on the 20th of October on the outcomes statements and where we are exactly with the GPW14, and we are also offering any additional regional or even sub-regional consultations if needed. We understand that that this takes time, and sometimes it's very difficult to digest complex issues and expect member states to react on the spot. So we really would like to do it in a very agile way, and I think the WIPRO pre-RC consultation was a good example for that. But we can also have a post-RC consultation if there's a need for it. Next one, please. Also click through this, please. Yes. Okay, so just to say what are the key elements of the GPW14 and where we are in terms of what we would like to change. As you know, GPW13 was anchored in the SDGs. It was country focused. There was a lot of emphasis on measurable impact, and it had the promote, protect, provide, the 3 billions and data and external relations partnerships element. The GPW14 builds very strongly on GPW13. We're not going for a big bang. It's going to be an incremental change to reflect the new realities that I talked about. So the focus on SDGs remain, and there's a clear commitment to further accelerate SDGs in this more complex environment. And the latest UN General Assembly reconfirmed the world's commitment to continue working on the SDGs with even more focus. Then we would like to align the global agenda for all health players. So we hope that this GPW14 will not be solely about what WHO Secretariat is going to do, but it will help to provide a compass for the other actors and partners in the health arena towards the major goals of the GPW14. Again, impact country and regional offices re-emphasized. We would like to engage with the key health determining sectors, and we also would like, because that was again one of the shortcomings of GPW13, to include a theory of change, which basically defines what is WHO's value added in achieving the outcomes and the SDG goals, and to explicitly state that. Again, it's something that everybody supports. Everybody wants to see what is WHO bringing to the table, but it's not so easy because we are engaged in so many areas and fields. Next one, please. This slide shows the evolving elements where we would like to focus on, and we've been receiving feedback that we are in the right direction in terms of within the promote, provide, protect. These are the sort of the big ticket items that require additional attention. One big item is climate change and health, and that will definitely be more pronounced in GPW 14 than in previous WHO documents, and I don't think I need to explain it specifically in this region how climate and climate change is impacting health and why it needs to be in the center. We also would like to look at the determinants and root causes of health, which drive the agendas. Under the provide element, we would like to look at inequities in coverage of essential health services and interventions. And we need to look at also reversing the trend in catastrophic health spending as one of the underlying elements of UHC. And for protect, ensure all countries prepared to prevent, mitigate health risks, and rapidly detect and respond to acute crisis and ensure essential services in protected crisis. So these are the evolving big items where we're going to focus on. And now what we are working on is to translate that into our results chain and results framework, and to come up with outcomes and outputs that address these issues. Next one, please. Next also, thank you. And this slide just shows that there are also, we haven't forgot about that, and we can't forget about, of course, the enabling functions on the bottom, governance and accountability, which basically cut across these all the operation, and equally science and evidence, data and information systems, technical assistance, and our delivery and coordination and leadership are also elements that are, one could say, more traditional, but we shouldn't forget about that, and they also need to be rethought in the context of GPW 14. The next one, please. Next one. Just click through this as well, because thank you. So just a word before giving over the word to Lynn, is that we've started costing the GPW 14, and obviously it's 4 years, so 25 to 29, and we were really advised to keep our ambitions relatively modest, and the underlying assumption, the main underlying assumption behind the figures is that our base budget is only slightly going to increase for some emerging priorities that will not be able to be accommodated within the program budget. And one of that is, for example, the mainstreaming of the remaining polio elements, which are in the polio segment and will have to be accounted in the base segment of the program budget, and then also strengthening accountability and country offices. These are sort of the main big ticket items that add to the base budget calculation. But we have committed, once the GPW 14 is in a relatively final form after the January Executive Board, to run a mini program budget prioritization and costing process between January or end January and end of April, and have a more detailed costing by outcome and potentially by outputs to be able to serve the needs of the investment round better, but also to give you more ideas about the emphasis and the relative emphasis among the different areas. Thank you very much, Lynn.
Thank you, Imre. Good afternoon. Can we continue with the slides, please? Next slide. Next slide. So I'm going to walk you through the situation of the investment round. And as Imre said, we had already a pre-RC briefing, so I will be relatively brief. So I want to draw your attention, first of all, to the decision of the World Health Assembly in May that followed actually the advice and the recommendation of the Working Group of Sustainable Financing, where the working group came with two recommendations to continue working on sustainable financing for the organization. One was the increase of the assessed contribution. The other was focusing on the voluntary contributions and looking at a form of a replenishment, as they called it at then, which we now call the investment round. So the investment round and the decision, as you see, is about fully funding or fully financing the base budget of the GPW 14. And what we're looking at and what you asked Secretariat to do is to prepare a full plan for this WHO investment round to be held in Q4 24. So we're looking at an investment round at the end of next year with objectives really to have a sustainable financing of the WHO budget, but also to increase our internal efficiencies and especially also, and I want to draw your attention to that, to drive political commitment for health, both globally and at country level. Next slide, please. Next slide. Thank you. I will be very brief on the timeline. We are currently in the consultation phase to prepare for the full plan to be submitted to the executive board for final adoption. And this is a critical moment in that. I want to draw your attention especially on a document that was circulated on Monday, asking you, giving a bit more detail than what I'm providing here today on the investment round and asking for your written comments by 27 of October. So we're really looking forward for your comments on that. Next slide, please. We need to develop a common vision of what is a successful WHO investment round. And this is what we are proposing today. So to have an opportunity to rally all stakeholders behind the GPW 14 and really turn the tide of the SDG 3. And for that, we're looking at fully funding the GPW base budget. So not the emergency appeals, because we have a separate process to do that. And to ensure predictability of funding for 4 years, while now we have very much shorter periods of funding. And you heard yesterday from both DG and the acting RD how that impacts our ability to deliver at country level especially, and also how that continues to leave pockets of poverty. Next slide, please. In doing so, we are going to build on the existing resource mobilization strategy. And that means we will strengthen our relationship with all member states, because you are the key shareholders, of course, of this organization. But we will also continue to work with the foundations that support WHO and looking at more longer term, broader umbrella agreement in line with the elements decided within the GPW. And then, of course, we will engage with private sector, but fully in line with the framework for engagement with non-state actors and through the WHO Foundation. Next slide, please. When we had the discussion on in the World Health Assembly to establish or to start the work on the investment round, there was a lot of concern of member states and partners that said that it would be a short period to transition to fully flexible and fully predictable funding. So for this transitional investment round, the proposal is that every pledge will count, regardless of the funding type and the timing of the agreement signed. And some member states also in this region have already multi-annual agreements that cover part of the investment round. So that part will be commitments from the period of 2025 until 2028 will be counted. But we will measure the success against the predictability and the flexibility. And to do so, we have developed evaluation indicators, which you find in detail in the consultation paper we have circulated, and we're really looking forward to your comments on that. Next slide. The investment round is also about organizational effectiveness, and there was a clear request to look at cost efficiencies. I'm not going to go in very much detail here, but we have done some benchmarking with other organizations, and WHO, in comparison to many others, has a quite lean team of dedicated resource mobilization staff. But we work throughout the organization on resource mobilization, and that means that many technical staff also work on proposal drafting, on grant management, on reporting issues. If we can reduce that, and if we can go for more predictable funding, longer term agreements, more broader umbrella agreements, that will be a real big efficiency, because it will provide time saving for technical staff to really do the operational work and implement the work that they need to do. And the other efficiency is what was mentioned yesterday multiple times, both by DG, but also and by the acting RD, but also by some of you, namely the stability of the staff and based on greater predictability of funds. And like Japan was saying, possible better planning for implementation of activities, because we know in advance what are the funds that we will have both at the regional level and at country level. And then please, my last slide. Next slide. Thank you. So just in closing, for us, the investment round is really linked to the WHO DNA as a member state organization. It's within the full oversight of the governing bodies. It will secure co-hosting of the investment round from all regions, and we're working across the 3 levels of the organization. So it's not a headquarters event, it's really also within the regions and the country office. And it aims to bring together all global health partners, building on existing events to really create momentum for this WHO investment round. Really looking forward to your feedback and your comments, and thanking you very much for your attention.
Thank you, Chair. Thank you, colleagues. Chair, back to you. Thanks.
Thank you. So we will open for questions or interventions from representatives who wish to speak on this item. Please indicate your wish to speak by clicking the big button on your microphone. May I invite the Philippines? Thank you.
Thank you, Mr. Chair. Thank you, Mr. Chair. The Philippines supports the plans for the adoption of the replenishment mechanism to improve sustainable financing of the World Health Organization, with a firm commitment to actively engage in the first WHO investment round processes towards building the financing envelope of the 14th General Program of Work. We saw how the Secretariat strived to fulfill the commitments in the program budget across all segments, despite the demands of large-scale emergency operations for COVID-19 response. We also saw the continued need to recalibrate funding to achieve intensified support for member states' social and economic recovery and to reverse the backsliding on universal health coverage goals. For GPW 14, we will remain faithful to our commitment on sustainable financing for the World Health Organization. Together, we can strive to decrease dependence on voluntary contributions so that we are able to achieve full, sustainable, and predictable financing that will help realize our goals and strategies under GPW 13 and 14. The Philippines is among the countries that piloted the impact measurement system for GPW results framework. We integrated results framework in our monitoring and evaluation framework for universal healthcare. We also recognize the utility of the outcome indicators as they are aligned with the SDGs, the UHC index, and the Health Emergencies Protection Index, and the Healthier Population Index in measuring reforms in a country. Extending GPW 13 and planning on the results framework and investments for GPW 14 require, number one, intense focus on expanding Health Emergencies Protection Index indicators. Number two, tackling the unequal and uneven progress on SDG indicators across populations and countries. And three, addressing the recurrence of funding gaps compounded by persisting challenge of pockets of poverty across programs and regions. SDG indicators are useful in tracking the Philippines' Universal Healthcare Act implementation towards achieving better health outcomes, stronger health systems, and access to all levels of care. We look forward to strong collaboration in the region for GPW 14 outcomes, indicators, and targets guided by our GPW principles of 1. Focus on impact and outcome. 2. Country-centeredness. 3. Integrated result structure. 4. Accountability, measurement and transparency. 5. Organizational flexibility. And 6. Inter-program and cross-function collaboration. Thank you, Mr. Chair.
Thank you. My call on Japan, followed by Australia.
Thank you, Mr. Chair. Japan appreciates the detailed explanation of GPW 14, the results framework and the investment round. We would like to make a few comments based on the information provided at the several consultations held with member states. First, we expect that the independent evaluation and the lessons learned from GPW 13 will be reflected in GPW 14. We would also like to expect that the outcome of GPW 14 and the WHO contribution to these outcomes are more closely defined, and indicators to measure and illustrate normative functions of WHO are set in order to explain the validity of contribution to WHO. The consultation document states that a health agenda will be set for all health players. We would like to ask that these means setting targets not only for WHO and the member states, but also for health partners. Regarding the investment round, we expect that the full detail of the event, including the funding and the target envelopes, will be shared with member states as soon as they are available for further discussions. In particular, we would like the Secretariat to provide further explanation on the funding target of investment round, as it is closely related to the discussion with GPW 14. Japan supports the sustainable financing of WHO and would like to continue to actively participate in the discussion to ensure that access of investment round and to further improve GPW 14. I thank you.
Thank you. I invite Australia, followed by the United States.
Thank you, Chair. Morning, everybody. Thanks for the presentations on the general program of work. We do thank Secretariat for the work in developing and coordinating consultation, as well as the results framework and the investment round. We did appreciate, and I think you highlighted that again this morning, the additional note that explained the interlinkages between the three mechanisms. That was actually useful. We also note that your plans draw on GPW 13's evaluations and that you have structured in some further consultations. So just to support that work. Broadly, we're pretty comfortable with the direction for GPW 14, as you've outlined. We note and support the emphasis on achieving unmet targets from GPW 13, acknowledging the complex global landscape and challenges which will impact a role over the coming period. We do appreciate the acknowledgement of WHO's role in the broader global health landscape and the future ambition. I'll come back to that balance a bit later. We support WHO's role in setting and aligning the agenda for all health players. Turning to some specific kind of inputs from Australia, we agree that achieving real change in WHO operations and capacities at country and region level must be a focus. So we've talked a bit about that yesterday. We're keen to see that translate into the general program of work for the next coming period. We do want to see some more detail on the practical implications of the vision that you've articulated so far. A couple of areas, how GWP 14 can support countries to build the capacity in digital health and delivery. Again, we've talked about that yesterday. And then an integration of the cross-cutting objectives within the program of work, including gender, sexual and reproductive health, equity, and human rights, as well as the further development of the accountability functions in the next iteration. Again, you talked about that results framework. These are, in our view, crucial elements that must be integrated into that forward work program. Again, just touching on that alignment across the broad kind of WHO, recognise the need for this program of work to align with member states' conversations on sustainable financing and agile member state task work group. That's something we want to keep seeing the linkages there. We acknowledge while it's important that that program of work has flexibility to respond to emerging priorities, we've got to keep that focus on budget discipline to make sure we protect the gains that we've had through the previous agreements. Just touching quickly on the investment round, we note the plans for the period. Thanks again for the details this morning and the way you see that playing out. We support the focused efforts on expanding the donor base. And again, just emphasise the importance that you've talked to around transparency and accountability in supporting partners so we can look to guarantee that more flexible-based funding. So in conclusion, supportive of the work so far, keen to engage further with these developments. We might follow up on a couple of these elements through the process and look forward to the zero draft with adequate time to consider before the January EB meeting. Thanks.
Thank you. I call on the representatives of United States of America to be followed by China.
Thank you and good morning, Mr. Chairperson. The United States thanks Wipro for the opportunity to provide feedback on WHO's proposed general program of work. We support WHO's efforts to develop a robust and comprehensive program of work for the period 2025 to 2028. GPW should first and foremost be a plan for WHO. We urge WHO focus on identifying concrete outcomes and outputs and articulating how WHO will demonstrate its own contribution and added value in achieving those results. This would facilitate accountability to member states and create a compelling rationale for the investment round. Also, echoing the comments of our colleagues from Japan and Australia, we would also note that WHO should stay, instead of covering the whole health sector, it should be focused on its current sort of priorities and making progress on the unfinished work of achieving SDG 3, as well as achieving universal health coverage, preventing communicable and non-communicable diseases, and promoting health for all should remain central focuses. We look forward to working collaboratively to create a transparent monitoring and evaluation framework to measure the progress towards GPW 14 goals. We appreciate WHO's plan to utilize existing metrics and indices so as not to increase the reporting burden on member states. The United States looks forward to the continued consultation process to develop the GPW 14. Thank you very much.
Thank you. I call on representatives of China to be followed by Republic of Korea.
Thank you, Chair. China would like to thank the Secretariat report on the consultation of the draft of the 14th JWP. The 14th GPW is going to have a profound impact on achieving 2030 SDG health goals. The new GPW should have a full engagement from members. China commends the Secretariat for maintaining consistency with the 13th GPW. China noted that the Secretariat has considered the changes in the global health governance since the pandemic. China suggests the drafting process to be more focused on health issues and achieve synergy among existing partners, mechanisms, and financing channels to ensure rational GPW and financing targets. China hopes the Secretariat can further explain the relation between the 6 strategic objectives proposed in the 14th GPW and the existing goal of a triple billion. China noted that the WHO Council meeting agenda item setup and the performance indicators are centered around the triple billion goals. We believe that the item settings and performance target system can maintain stability and consistency so as to improve work efficiency and outcomes. Thank you, Chair.
Thank you. I call on the representative of the Republic of Korea.
Thank you, Chair. Thank you. Good morning, everybody. We express our appreciations to the Secretariat for the detailed explanations. The Republic of Korea welcomes the development of the WHO General Program of Work 14, which outlines the WHO policy objectives and strategic priorities for the period of 2025 to 2028. We look forward to the GPW 14, including the lessons learned from the COVID-19 pandemic and thorough evaluation results from the GPW 13, and focus on utilizing the remaining time and resources in a more efficient manner with the overarching goal of accelerating the progress towards meeting the SDGs by 2030. The Republic of Korea notes that GPW 14 has been developed as an extension of efforts to strengthen the sustainable financing of WHO. In the last World Health Assembly, member states decided to increase the assessed contributions, introduce investment rounds to mobilize flexible funds, and undergo a WHO reform to support WHO's flexible and predictable funding. We hope such decisions will help strengthen WHO's financial independence, drive organizational reform, and support effective and efficient implementation of GPW 14. Korea emphasizes that GPW 14 should provide a clear and convincing explanation of WHO's work. We welcome that GPW 14 is being established in close consultation with member states, striving for a result-oriented performance framework that resonates with key stakeholders and the general public. In this context, we support the comments made by Japan, Australia, and the United States on the need for focus and concentration on core activities. Lastly, the Republic of Korea reiterates that WHO reform is closely intertwined with sustainable financing. We are committed to proactively supporting WHO reform efforts and contributing to ensuring WHO's sustainable financing at the same time. We'll be providing additional comments as requested by the Secretariat by 27 October. I thank you.
Thank you. Thank you very much. May I now call on the Secretariat to respond to the points that have been made?
Thank you very much, Mr. Chair. Let me first turn to my colleagues Imre and Lynn to see if they want to pick up on any of the issues. Imre first.
Thank you very much, Acting RD. So I would like to start by saying that we are working very closely on with the evaluation team of GPW 13. It's an external company that is doing that under the management of our evaluation department. And the evaluation department agreed that we're doing this evaluation a little bit differently because obviously we're building GPW 14 at the same time as they are preparing the evaluation. So there's no point that they come up with some evaluation outcome when the GPW 14 is already finished. Then we can't reflect their findings. And we're having regular meetings with them where they are informing us about what they find and where they think we need to change. And interestingly, one of the elements, and that would be a key recommendation from the GPW 13 evaluation, is that GPW 13 was very inward looking. It was all about the Secretariat. And that we need to think and discuss whether GPW 14 should be more outward looking. So it's also in response to the US that there's this little bit of a dilemma. On one hand, to follow up on the GPW 13 evaluation and have a more outward looking document. At the same time, the investment round is about what are the needs of the Secretariat in order to deliver the objectives of the GPW 14. So we need to somehow bring these two elements together. There was also a question about the health partners in this context, and the idea is that I mean, obviously, what is underpinning GPW 14 are the SDG goals. And in that sense, there's no change, and that should also direct our health partners, etc. But what we are trying to do is to have an agreement, and that's why there's an involvement with our health partners, is to have a little bit more detailed clarity on what's going to happen between 25 and 28, and that we jointly contribute the achievement of those main elements. There's also very clear commitment that in terms of measurement, we do not want to bring in new indicators as much as possible. So what we will do is that once the outcomes and the outputs have been firmed up, we are going to look at not only the GPW 13 measurement, but also other existing and already measured indicators, and see how we can redistribute them to measure the GPW 14. Again, I just want to flag what is our challenge here, that we not only need indicators which are consistent and not providing additional burden to you, and of course, where there's enough availability of data, but we also need indicators where we can show progress between 25 and 28. And that's very difficult because of the nature of many of the health indicators. So again, it's something that everybody agrees. We need to strengthen accountability, but exactly how to do that while trying to not to have new indicators, have clarity, not to complicate our lives yet, be able to measure something within 4 years, it is going to be a little bit of a challenge. Yes, gender equity and human rights, absolutely important. And we would like to go beyond just slogans and statements that we had before in previous documents. And really, we would like to come to a next level in terms of reflecting gender equity and human rights in GPW 14. Again, it's easier said than done. With the acting director of gender equity and human rights is part of the core team that is working on the GPW 14 document. And we have some ideas. We will show them to you, but we would like to go basically a step further and maybe have it by outcomes or even by outputs, and to sort of reflect what is it that we are going to do in this area. And it's absolutely important, and thank you for reminding us about it. Lynn, over to you.
Thank you, Imre. Thank you, colleagues, for your comments on the investment round, and special thanks for the encouraging words about sustainable financing of WHO. I want to just briefly touch upon two questions that were posed. First of all, on the investment round event itself. So currently we are discussing with several member states from each region to be co-host or to work with us as host or co-host of this final event. It is not yet there is not yet a final decision of it, but we are hopeful and confident that we will be able to include this in the final version that goes to the executive board. The same is true for the, not fully the same is true on the target envelope for the investment round. This is very closely linked on the development of the GPW 14, of course. And as you heard Imre saying earlier on, there will be an additional effort done by the Secretariat between January and the World Health Assembly, the final decision of the GPW, on fine-tuning the actual envelope of the GPW 14. And based on that, we will be also able to present you a more detailed envelope of what is the target envelope for the investment round. Many contributors, many member states also have asked to have a bit more detail on that. So we're really working towards that. But in general terms, I can say already now that the target envelope is definitely focused on the base budget, and we will decrease from that base budget the AC contributions and calculating the increased AC contributions as per last year's decision, but also focusing only on the technical areas of work. So we will not include in that envelope the enabling functions, but only the technical areas of work. So with that, I hope that I gave some explanations, of course, but definitely we will come back to this when we have more detail. Thank you.
Thank you very much, Imre and Lynn. I think I can speak also on behalf of Dr. Tedros when I say that the GPW 14, the investment round, and also the result framework are strongly intertwined. And this is the message also from the Director General, and this is why we brought these three issues together, because we know how important it is for you to ensure accountability, which we can ensure through the result framework. The GPW 13 and 14 are very important global documents. We consider it both internal and outward looking, an external document. Also with the member states, particularly also because this is the document on which the program budgets are then based. And this is why we try to have so many global and regional consultations. And I still think that one more consultation with the Western Pacific region, sometimes in November, before the GPW document is finalized for the executive board, might be a good opportunity. We also think that we need to ensure the continuity between the GPW 13 and 14, and the evaluation is a very good opportunity for that. And as Imre highlighted, we are working with the evaluation team. Then the SDG implementation and the acceleration of the SDGs is crucial because we had a setback during the COVID, and the SDG forum also requested this. So there has to be a strong emphasis in the GPW 14 on this, which is already highlighted in the document. And then finally, the result framework is something that was introduced during the GPW 13, and that's for the accountability crucial. And it needs to be updated with the new outcomes, outputs, as Imre highlighted. But then we need to institutionalize it also in the different parts of the organization through regional committees. And also it is linked to the capacity in the countries and country offices for health information system and data collection. So in the CPCP funded positions, we are also looking at this and integrating the need for that. And the investment round is an exciting new initiative. We are looking forward to a successful start during this first round, but obviously continued discussions with the member states will shape the final version. Thank you very much for your inputs, and back to you, Chair. Thank you.
Thank you very much, Dr. Jacob. Respected colleagues, we now move to agenda item 11. Health Security Document WPR/RC74/5. May I invite Dr. Babatunde Olowokure, Regional Emergencies Director, WHO Health Emergencies Program and Director, Health Security and Emergencies, to introduce this item.
Thank you, Chair. Mr. Chairperson, distinguished representatives, I am pleased to present for your consideration document WPR/RC74/5, the draft Asia Pacific Health Security Action Framework. The Western Pacific region faces continuous and increasingly complex public health threats. These threats are caused by multiple types of hazards, including infectious and zoonotic diseases, antimicrobial resistance, natural hazards such as typhoons and earthquakes, food safety incidents, and technological hazards. The impact of major public health emergencies extends far beyond health to affect wider social and economic realities. Emergencies disproportionately impact groups with health or socioeconomic vulnerabilities, widen existing inequities, and result in lasting negative impacts. Pacific Island countries and areas are particularly vulnerable to these threats. They face a complex mix of social, economic, and environmental challenges that make them less resilient to shocks caused by public health emergencies. Health security systems protect the health of populations by preventing or mitigating the public health impact of emergencies. They also foster socio-economic stability and development. The 2003 SARS outbreak was a global wake-up call. It showed the necessity of investing more to achieve better global collaboration on issues of international health security. The international health regulations were finalized in 2005. That same year, the Western Pacific Regional Committee meeting endorsed the first version of the Asia Pacific Strategy for Emerging Diseases and Public Health Emergencies. The aim of the strategy was to support countries to strengthen capacities and build the systems needed to detect, report, and respond to public health emergencies. To that end, the strategy guided member states in implementing and advancing the revised International Health Regulations 2005. The region has made many collaborative and strategic investments to strengthen health security systems. Member states can take pride in the long list of achievements and improved responses to public health emergencies over the years. The value of this approach was clear in the rapid and effective responses of countries and areas in this region during the early acute phases of the COVID-19 pandemic. While the region has made significant progress since SARS, the pandemic's impact on health systems, societies, and economies highlights the increasingly complex nature of public health threats. Addressing these threats requires more comprehensive, integrated, and forward-looking approaches that go beyond the health sector to safeguard health security. The Asia Pacific Health Security Action Framework has been designed to do just that. The framework brings together multi-sectoral, whole of government, and whole of society stakeholders to support prevention, preparedness, readiness, response, and resilience in relation to multi-hazard public health emergencies. It is an interconnected and collaborative approach to strengthening resilient health security systems. At the same time, the framework's broader scope supports progress towards universal health coverage and the Sustainable Development Goals, and also supports the One Health approach. The Regional Committee is invited to consider for endorsement the draft Asia Pacific Health Security Action Framework. Thank you, Mr. Chairperson.
Thank you, Dr. Olo Wukuri. I understand the Secretariat has prepared a video on this item. Please play the video.
Communities in the Western Pacific region face continuous and increasingly complex threats to public health. The impact of public health emergencies can extend beyond health, impacting entire economies and societies. Since the 2003 SARS outbreak 2 decades ago, our region has invested strategically in health security systems, and the region's COVID-19 response has demonstrated the strength of these investments. However, the pandemic's widespread impact on health systems, societies, and economies highlights the need for a comprehensive, integrated, and forward-looking approach to health security. The Asia Pacific Health Security Action Framework aims to build stronger and more resilient health security capacities and systems through coordinated One Health, multi-hazard, and multi-sectoral approaches to secure the health, lives, and livelihoods of people in the Asia Pacific. Together, we can protect the Asia Pacific region from the impact of future health emergencies.
Thank you. We will now suspend this item and break for coffee. We will resume consideration of this item and turn to Member States' interventions when the plenary sessions reconvenes in 15 minutes. Thank you. Bravo, well done, everyone. Okay. Now, we will resume our consideration of agenda item 11, health security. Document WPR/RC 74/5, and hear from representatives who wish to speak on this. Please indicate your wish to speak by clicking the big button on your microphone. I call on representatives of Philippines, followed by Mongolia.
Thank you, Chair. The Philippines supports the adoption of the Asia-Pacific Health and Security Action, APHA's framework. We are of the view that the document reflects the lessons learned from the COVID-19 pandemic and provides a more action-oriented approach to improve and strengthen health capacities and systems, especially on surveillance. We believe that the framework will further guide the Western Pacific region member states in enabling its surveillance systems to be multi-sourced, adaptable, and agile for a more efficient and effective early warning mechanism to promptly trigger public health interventions. While the framework can be considered as more ambitious than the previous instrument of the Asia-Pacific Strategy for Emerging Diseases, the Philippines trusts in unity in the Western Pacific region in advancing both health security and health systems strengthening. We wish to share with the committee the following key initiatives of our country that align with the framework. One, early this year, we developed the Philippine Pandemic Preparedness, Response, and Resilience Plan with its objective strategies already aligned with the 6 domains of the APHA framework. It sets specific implementation plans, operational considerations like coordination mechanism, legal instruments, financing, logistics, among others, and identified barriers with corresponding solutions for the priority strategic actions under the 6 domains. 2, a 2-year operational plan under national health security was also drafted in consultation with the multiple sectors with a goal to improve the overall international health regulation capacities. And 3, since 2011, the Philippine Interagency Committee on Zoonosis serves as the functional, sustainable One Health governance platform to strengthen coordination between the animal, human health, and environmental sectors. One Health should be our common guiding principle to highlight that the risk of pandemics is influenced, affected by animal health and environmental conditions, as well as to emphasize the importance of multi-sectoral engagement to address human, animal, and environmental disease prevention and control. The Philippines remains steadfast to our commitment in sustaining the progress made and scaling up efforts toward a path of a world that is safer and more secure from public health threats and hazards. Thank you, Chair.
Thank you. I call on representative of Mongolia to be followed by Japan.
Thank you, Mr. Chair, honorable ministers, distinguished delegates, ladies and gentlemen. The COVID-19 pandemic, the most devastating of all public health emergencies ever experienced by the humankind, has clearly demonstrated the importance of collaboration of the healthcare sector with different non-healthcare sectors and a whole of government and whole of society approach in responding to public health threats. While the pandemic has challenged our health security capacities in terms of prevention, preparedness, readiness, and response, it has also served as an opportunity to learn and improve our core capacities. Health security has become even more vital now than ever before in our region and the world as a whole, as emerging and re-emerging infectious disease and public health emergencies and events, including natural and man-made disasters and outbreak-prone diseases, threaten the health and well-being of people. Climate change-induced re-emerging infectious disease from animal to human remain as a threat for the countries in the Western Pacific and others, urging us to strengthen our existing capacities and resilience towards greater health system security. Distinguished delegates, based on the lessons learned from the pandemic, Mongolia recognizes the necessity for comprehensive, integrated, whole-of-society approaches in addressing the health and well-being needs of the population and remains committed to further strengthen our traditional core capacities as well as the newly built-up capacities while continuously exercising a learn and improve method. My delegation would like to emphasize the crucial role of the Asia-Pacific Strategy for Emerging Disease and Public Health Emergencies in building the core capacities of the international health regulations in the Western Pacific countries, including mine. It has been instrumental not only in building the core capacities for the national early warning, response and surveillance system, but also expanding multi-sectoral and cross-sectoral collaboration and coordination. The system and capacities were well demonstrated in our national response against the COVID-19 pandemic. Furthermore, we would like to thank the Secretariat and the WHO Country Office team for the ongoing technical support in conducting our self-evaluation exercise and preparatory works for the second joint external evaluation of the IHR core capacities scheduled to take place in November this year. On this note, we welcome the endorsement of the draft Asia-Pacific Health Security Action Framework. Thank you, Mr. Chair.
Thank you. I call on representative of Japan to be followed by Lao DPR.
Thank you, Chair. Japan appreciates the drafting of the new action framework with a view to strengthening health security. We would like to support this draft framework, considering our lessons learned from the COVID-19 pandemic, which had a profound impact on human health, our societies and economics, and the need to prepare for the response to increasingly complex and various health emergencies. Similar issues were discussed at the 15th Pacific Health Ministers meeting held in Tonga last month, where the importance of strengthening health system resilience was recognized in order to respond to health emergencies in the future. We appreciated the draft particularly for identifying 6 interconnected areas of health security system and developing a framework based on the experiences and lessons from preparedness and response activities in the Western Pacific region over the past 2 decades. Furthermore, we note that the draft is intended to target all stakeholders in industry, government, and academia. One of the keys is how to work in collaboration with non-health sectors, international organizations, and the private sector to address the important issue of health security, which affects the whole of society, in addition to commitment by the member states. Finally, we look forward to being updated on a concept future support build upon this draft. I thank you.
Thank you. I call on the representative of Lao DPR to be followed by New Zealand.
Thank you, Mr. Chairs, Dr. Susanna Jacobs, Honorable Health Ministers, distinguished guests, ladies and gentlemen. For almost 2 decades, the 3 iterations of the Asian Pacific strategies for emerging disease and public health emergencies are upset, guided efforts in the Lao People Democratic Republic to strengthen core public health capacities under the international health regulations to detect and respond to health emergencies at national and sub-national level. The COVID-19 pandemic clearly demonstrates that public health emergencies can have a devastating impact on socioeconomic developments, highlighting how critical a whole societies and a whole of government approach is to health securities. We welcome the new Asian Pacific Health Security Action Frameworks, which builds on the achievement of upset using a broader multi-sectoral approach. How we move this forwards in the Lao PDRs with clear actions to be implemented its extensions, and we request guidance from WHOs and partners on this as we collectively continue to strengthen health securities in the countries and the regions. We must also acknowledge that universal health coverage is necessary for building a resilient health systems to achieve health securities, and we appreciate that this new frameworks advocates for a system approach. Our government is committed to achieving USCs. We have worked hard to expand health services, improve the quality of those services, and strengthen financial protections. Recognize there is more work to be done to reach those still left behind, especially in remote areas, and that we need longer-term investments to strengthen the health workforce, to ensure preparedness and response for any future public health emergencies. The governments of Laos, People Democratic Republics, with the support from WHOs and other partners, remain committed to strengthening its health security capacities and systems so that we are better prepared to respond for future pandemics. I thank you, Mr. Chair.
Thank you. I call on representative of New Zealand to be followed by Marshall Islands.
Thank you, Honourable Chair. Tēnā koutou katoa, greetings to you all. Aotearoa New Zealand is pleased to endorse the Asia Pacific Health Security Action Framework. We thank the Western Pacific Regional Office, members of the APSED Technical Advisory Group, member states, partners and experts for their contribution to the new action framework. We are proud to have had the opportunity to support and contribute to this mahi, which means work in our Indigenous Māori language, through the engagement of our technical experts. The COVID-19 pandemic highlighted gaps in the prevention, preparedness, readiness and response to public health emergencies in our region. With public health threats expected to grow in frequency, complexity and impact in the Western Pacific, our health systems must now prepare for situations in which multiple emergencies occur simultaneously or in quick succession. Turning now to the draft framework itself. The move from the previous 8 focus areas to the 6 new domains consolidates the key activities and capabilities in a stronger and more integrated way. We are pleased to see attention to vulnerable populations and the need to apply a disability and equity lens to ensure inclusive health security action to reach the unreached. That no one or community can be left behind is a key lesson from Aotearoa New Zealand's recent pandemic and natural disaster experiences. Further efforts are needed to address barriers such as digital exclusion, lack of health literacy, and providing disabled communities with accessible information and communication when needed. Aotearoa New Zealand notes how valuable the annual APSED Technical Advisory Group meetings have been, a forum where experts can share experiences, discuss challenges faced, and agree on regional health security priorities for the coming year. We thank WIPRO for its efforts to continue to support this valuable process. Chair, Aotearoa New Zealand will continue to support and mobilise collective action to strengthen regional and global health security, and we look forward to continuing to listen, learn and share our experiences with fellow Western Pacific member states. As I noted yesterday, we have a saying in Aotearoa New Zealand that speaks to the importance of shared endeavour. Ma whero, ma pango, ka oti ai te mahi. Through cooperation and combined effort, our work will be completed. Ngā mihi nui, thank you.
Thank you. I call on representatives of Marshall Islands to be followed by Singapore.
Thank you, Honorable Chair, distinguished delegates, ladies and gentlemen. We find the world in an unprecedented crisis, bearing witness not only to ongoing health emergencies and its accompanying economic fallout, but also the ravages of climate change that are upon us today. The Marshall Islands has no higher ground or retreat. We consist of atolls so narrow, you can often stand in the lagoon and see the ocean waves crash on the other side. The impacts are already felt today in king tides, the growing power of typhoons and salt water spewing from wells inundated by the ocean, and they are worsening. Without increased leadership, the consequences will be catastrophic for us all. Whether the threat is the financial crisis, public health, security tensions, or climate change, we rely on WHO's continued leadership to meet today's challenges. In the recent COVID-19, RMI was not alone. It took literally a village. It took a multi-sectoral approach with other government ministries and external partners to be able to respond and treat our communities. Further, the ongoing project on enhancing the resilience of health systems to climate change and emerging pandemics in the Republic of the Marshall Islands continues to make strides in the RMI with strong partnership from communities, especially our youth. This project will allow for further collaboration and link into early warning alert response systems for communicable diseases, as well as environmental health programs and building capacity. The RMI takes note that the draft Asia Pacific Health Security Action Framework reflects on these experiences and wishes to support the endorsement of the framework. Once again, I express RMI's gratitude and appreciation for the opportunity to be here, and I congratulate the success of this important gathering and for your tireless efforts in organizing this conference. Komultado. Thank you.
Thank you. I call on the representative of Singapore to be followed by Tuvalu.
Thank you, Mr. Chair. Singapore supports the Asia Pacific Health Security Action Framework. It helps member states advance multi-sectoral health security capacities and strengthen our resilience to public health threats. Allow me to share 3 points. First, enhancing regional surveillance capabilities. Establishing strong communicable disease surveillance systems is key for the early detection of emerging pathogens with pandemic potential. This allows our region to rapidly implement response measures to reduce the potential public health threat. In response to the Pandemic Fund's first call for proposal in May 2023, Singapore, on behalf of all ASEAN member states, submitted a proposal to strengthen regional genomic surveillance capabilities in our region. While the proposal was not supported for funding by the Pandemic Fund, ASEAN intends to continue with implementation of the activities proposed to strengthen bi-regional capabilities. Second, vaccine manufacturing. One of the collective failures in the global COVID-19 response was that vaccines were not sufficiently manufactured and distributed at scale and at speed. Even as efforts are in progress to establish regional vaccine manufacturing capabilities, we need to recognize the importance of a strong international free trade system to ensure free and open export of raw materials and medical countermeasures. Singapore is committed to supporting this. Singapore has a significant pharmaceutical sector. Throughout the COVID pandemic, flow of goods and materials into and out of Singapore remained free and unimpeded to other countries in need of such critical products. We are committed to maintaining this free flow in future crises. Third, ensuring that each member state can fulfill and maintain its international health regulations, core capacities, and other multi-sectoral capacities stated in the new Asia Pacific Health Security Action Framework. In Singapore, we undertook a major post-pandemic review and published a white paper on our national COVID-19 management efforts. A key follow-up action is to consolidate public health functions across government agencies into a single communicable diseases agency to manage future complex health emergencies. At the regional and international levels, strong collaboration among member states, communicable diseases agencies will be key in addressing future global health threats. We look forward to working with all partner agencies. Thank you.
Thank you. I call on the representatives of Tuvalu to be followed by Brunei Darussalam.
Honorable Chair, Honorable Ministers and delegations, ladies and gentlemen. The recent pandemic COVID-19 have taught us many lessons and pointed out existing gaps within our health systems. The chance for new emerging infectious disease is highly, which may also contribute to the rising of antimicrobial resistance in the future. In our effort to ensure that we are well prepared and able to respond and protect our people to any form of disease outbreaks or pandemic, we have focused and invest on improvements of our diagnostic capability by enhancing our laboratory capability through improving our microbiology lab services and to ensure we have the basic diagnostic ability available to us on the ground. As a low-lying atoll, we are so prone and vulnerable to existing threats and impact of climate change. As part of our response, we are taking steps to protect and counter the adverse impact of climate change and disease outbreaks. Apparently, we are in the process working closely in cooperation with our community, WHO, UNDP, and underfunding support from the GEF to create more resilience, civilians, and systems that will allow us to detect earlier, pick up, and monitor system that will allow us to detect and early pick up, monitor to progress of any disease in the country, to allow us to respond more effectively. I kindly seek the assistance of WHO Regional Office to assist Tuvalu, the Ministry of Health, in establishing our national CDC to allow our medical team, emergency team, to be better prepared and ready to respond to the disaster or any forthcoming pandemic that may reach our shore. Mr. Chairman, this is the second time I have reminded this. Please take note of that. Moreover, we are so fortunate to have support of our donor partners, including the governments of the Republic of China and Taiwan, who assist us in establishing and improving our digital patients information systems, a system that will allow us to keep our information safe and at the same time allow our clinicians and other health professionals to easily retrieve information and store, monitor, and access for patients if there is a need. Considering the importance of health security and the importance of the region and us, Tuvalu strongly supported and endorsed the Asian Pacific Health Security Framework. I thank you, Mr. Chair.
Thank you. I call on the representative of Brunei Darussalam to be followed by Micronesia.
Thank you, Mr. Chair. Good morning, Chair, Excellencies, delegates, ladies and gentlemen. Brunei Darussalam thanks the WHO and APSUTTEC members for the draft Asia-Pacific Health Security Action Framework and applauds the inclusivity of the framework to involve the engagement of non-health sectors as well as stakeholders from the private sector, academia, civil societies, and communities. This is paramount as we adopt a whole of government and a whole of society approaches to ensure health security is mainstreamed into all relevant policies and practices. While in principle, Brunei supports the introduction of this framework, we wish to highlight two concerns on the implementation of this framework at the national level. First, considering the holistic approach taken to strengthen health security, how do we translate this framework into layman terms in order to garner interest and promote buy-in to engage the non-health sectors, relevant stakeholders, and communities? Second, member states differ in their capacities and resources to implement this framework. Capacity building, workforce training, community engagement, and financing are among some of the key areas that member states may benefit support from. How can WHO assist member states in these areas of need crucial for implementation of this framework? Ladies and gentlemen, Brunei stands in support to strengthen health security in our region and firmly believes that the need to ensure equity and solidarity is strongly emphasized in this framework. We therefore welcome collaboration with WHO and other member states in order to work jointly to implement this framework at the national, regional, and global level. Thank you, Chair.
Thank you. I call upon representative from Micronesia to be followed by Malaysia.
Thank you, Honorable Chair. On my utmost respect to Secretary honorable members, ladies and gentlemen. Let me first appreciate and congratulate the Committee on Health Security for successfully completed the draft of the Asian Pacific Health Security Action Framework. The Federated States of Micronesia welcomes the report on health security by the Secretariat. In our view, the report contains the essential elements of early identification and response to public health threats and emergencies. To maximize effectiveness and impact, implementation of action must be coordinated. We look forward to working with WHO and partners to strengthen our health systems and build resilience in our area of security. FSM fully endorses the draft of the Asia Pacific Health Security Action Frame. Thank you.
Thank you. I call upon representative from Malaysia to be followed by Cambodia.
Thank you, Mr. Chair, Head of Delegates, ladies and gentlemen. Very good morning to everyone. The COVID-19 pandemic revealed the strengths and gaps in countries' level of preparedness. To more effectively respond to the current pandemic and prepare for future pandemics and emergencies, it is very crucial to identify the key learnings from the COVID-19 response to further strengthen health security and health system resilience. Countries need to be operationally ready to respond to any health threats with tailored preparedness plans in hand and better coordination and collaboration with other sectors. Health emergencies can be managed effectively if health systems have been strengthened during peaceful times. The 5 lessons that has been learned from the current pandemic: one is the need for good collaboration and coordination among various sectors, including public, private, which is held in all policies. Efficient integrated surveillance system for early detection of diseases, early community engagement and empowerment. Financial sustainability and flexibility needs to be built into the public financial management systems to fund the unanticipated expenditure. And finally, the whole of government and whole of society approach to fight any pandemic or public emergencies is very crucial. The Malaysia Strategy for Emerging Diseases and Public Health Emergencies, or we call it as MySat2 work plan, is closely aligned with the broader Asia Pacific Strategy for Emerging Diseases. Malaysia's work plan encompasses various key aspects, including surveillance, capacity building, risk communication, international collaboration, research and development, and health system strengthening. And these components are strategically designed to enhance Malaysia's preparedness and response to emerging diseases, both within the country and in coordination with the Asia Pacific region. Likewise, Malaysia's work plan seamlessly integrates with the overarching Asia Pacific strategy, emphasizing collaboration and a coordinated approach to effectively address emerging health threats in the region. Malaysia acknowledges and supports the Asia Pacific Health Security Action Framework for strengthening the capacity building among member states. We hope that new domain-based approach stated in the framework will be in line with global frameworks and legally binding instruments such as the ongoing International Regulations Amendment and WHO Convention Agreement or other international instrument on pandemic prevention, preparedness and response development. Malaysia believes that the Asia Pacific Health Security Action Framework is a good initiative in preparing Asia Pacific regions to face any health emergencies in the near future. Hence, we fully support for the endorsement of this document. We wish to suggest for supporting documents to be added to this framework, as it will serve as a guide that will help member states in implementing the strategies proposed. Malaysia hopes that WIPRO will continue its support in capacity building in the region, especially in pivotal areas identified in the strategic framework, so that future outbreaks with pandemic potential could have been foreseen and prevented, or the spread could have been more effectively contained, thus causing less social and economic disruption. Thank you, Session.
Thank you. I call on the representative of Cambodia to be followed by China.
Honorable Chair, Excellency, ladies and gentlemen, Cambodia investment in health security over the past 2 decades, guided by the Asia Pacific strategy for emerging disease and public health emergency upset 3 have paid off. The whole government, the whole of society approach was pivotal in our successful response to COVID-19 pandemic, emphasizing the importance of unity and collaboration across the sector. Cambodia has actively engaged in shaping the Asia-Pacific Health Security Action Framework by participating in country consultation and in meeting of bi-regional technical advisory group on upset 3. We reaffirm our commitment to health security effort, and we firmly endorse the new framework and its system approach, recognizing its potential to fortify health security comprehensively. The new framework is timely for Cambodia to have outlined key priorities, including joint external evaluation (JEE) in May 2024, and subsequently development of new national action plan for health security that is aligned with the regional health security action framework and incorporate with the finding of JEE. Guided by principle of solidarity and cooperation, we must continue to strengthen and expand multi-sectoral collaboration beyond the health sector to address gap and advance coordination for health, emergency preparedness, and health security. Cambodia welcome and look forward to continue to work with the WHO and all the member states in the Western Pacific as we advance health security in our country. I thank you very much.
Thank you. I call on the representatives of China to be followed by Solomon Islands.
Distinguished chairperson, distinguished delegates, China pays a lot of attention to international collaboration on infectious disease prevention and control since the establishment of National Mission of Disease Control and Prevention, especially during the pandemic. We're in close contact with WHO on our obligation as a member state and contribute to building towards a global community of health for all. And we support the action framework. We want to share with you some points of our experience during the pandemic. China has given full considerations to WTO protocols. Based on China's reality, we have expanded surveillance channels and targets. We have established detection and early warning systems with case reporting, febrile clinics, community sentinel points, sentinel hospitals, and urban municipal sewerage monitoring in a total of 10 subsystems. We have optimized our policy by downgrading COVID to Class B infectious disease management. We have carried out monitoring of other statutory infectious diseases with monthly analysis and statistics and the timely publishing of data on morbidity and mortality. Talking about revision to IHR, we are supportive of necessary and targeted revisions so as to enable WHO and signatory parties to adhere to this regulation. We have always taken active part in the revisions. We have offered our suggestions during the previous 5 working group meetings. We believe the revision should be built upon principles of respect for sovereignty, solidarity, cooperation, equality, mutual trust, so as to promote health governance, coordinated response to health risks, amongst other things. In recent years, China has actively built up national, provincial, municipal, county, and all levels of emergency response systems with ever-improving management, contingency planning, and response capabilities. We have established 40 emergency medical teams around the country. During the COVID-19 pandemic and other emergencies, we provided effective response. 5 teams got accreditation from WHO to become international EMT teams. They went to Africa for the fight against Ebola and the post-earthquake relief efforts in Nepal. China is taking an active part in international actions for medical emergency response. We'll continue to send our teams in the international scope, and we will assist in capacity building and personnel training in developing countries while sharing with you experience from China. China will be assuming more international obligations and responsibilities in order to contribute to safety, health, and life of all people. Thank you.
I call on the representatives of Solomon Islands to be followed by Australia.
Thank you, Honorable Chair. The Solomon Islands is confronted with numerous health security challenges, including health pandemic outbreaks such as COVID-19, measles, and vector-borne diseases. These health emergencies serve to remind us of the importance of having robust prevention, detection, and response strategies in our health systems. We have extracted invaluable lessons from these encounters and are making progress to refine our approaches to tackling and containing similar future pandemics. We also established the Public Health Emergency and Surveillance Unit as our strategy to bolster our defense against such threat. This unit is tailored to meet our distinct needs, and it encapsulates vital components ranging from international health regulation to respond to public health emergencies, including antimicrobial resistance, ensuring we are equipped to handle varied health crises. On our preparedness and response plan, we have been successfully implementing focused on 6 strategies. We have developed an integrated management system of preparedness and response using whole government and whole society approach, implemented integrated severe acute respiratory infection, influenza-like illness, and COVID-19 surveillance and response, practical prevention and containment of outbreaks, including pharmaceutical and non-pharmaceutical public health intervention and infection prevention control, roll out the health system response, including clinical management and Solomon Islands medical emergency team, implemented risk communication and monitoring and evaluation. The 2022 to 2021 National Health Strategic Plan was developed with key considerations to give health security and ensuring that all Solomon Islanders have access to quality health care. With the consideration of existing legislations, the National Health Emergency Plan is aligned with national strategies from 2016 to 2035 that give emphasis on resilience, disaster management, and ecological sustainability. Tuberculosis is a re-emerging disease of significance in Solomon Islands, and in this regard, we have crafted a prevention leading to notable increase of the country approach to health emergency had been based on Asia-Pacific strategy for emerging disease and public health emergencies, which provides WHO member states in Asia-Pacific region a common framework for implementing and strengthening the core capacities required by the international health regulations. We recognize the evolving challenge in the global health security and fully support the advancement being made through the Asia-Pacific Health Security Action Framework. Since the inception of the Asia-Pacific Strategy for Emerging Disease, the public health emergency in 2005, there has been significant progress in our region, as it is evident from the legislative ability and effectiveness of response to the initial phase of COVID-19 pandemic. However, the extensive repercussion of this pandemic on our health system, economies, and societies highlight the ever-growing intricacy of public health threats and underscores the need for more integrative, far-sighted approach. The new framework aims to accentuate this by fostering multi-sectoral collaboration to fortify resilient health security system. This is not just about encountering disease, it's about the interconnectedness of health security with universal health coverage and the broader sustainable development goals. Honorable Chair, Solomon Islands endorse the Asia-Pacific Health Security Action Framework. I thank you.
Thank you. I call on the representatives of Australia to be followed by Hong Kong, China.
Thank you, Chair. Australia welcomes this final draft of the Health Security Action Framework and thanks Member States and Secretariat for their efforts in drafting the document. We see it as a thorough, practical and well-structured guidance document, and we're really pleased to endorse and accept the framework. Chair, my colleagues have talked to context and highlights of the framework, so I won't repeat many of those points. I just want to turn more to next steps. Of course, it's incumbent on all of us that we act now to implement the framework and look to put it in practice. Sustained investment in health security capabilities, as well as in routine public health functions, systems and services is critical. As raised by some of the colleagues today already, we also support WHO's proposal in section 4.1 to develop an implementation guidance to assist member states to more closely align their systems and practices to the framework. We welcome advice on a proposed timeframe for development and release of this guidance. Again, as some of my colleagues have said, practical support should be tailored and differentiated to respond to the different capacities and needs across Western Pacific region member states, with coordination across many of the global health organisations. Again, I think as Malaysia mentioned, we acknowledge the importance of adapting actions under the framework to accommodate the outcomes of the INV and the IHR negotiations. Really appreciate the briefing the other night, and in particular appreciate your efforts, Babatunde, to MC through dinner, was noticed. We echo the encouragement for active engagement in these negotiation processes as we look to strengthen the legal frameworks. Interested to hear the Secretariat's reflections on how it may support countries in our region, including Pacific Island countries, to access financing from the Pandemic Fund, and welcome further information in due course from the Secretariat on how the framework will be adapted and amended, noting that health security landscape is very dynamic. Thank you.
Thank you. I call on representative of Hong Kong, China, to be followed by the United Kingdom.
Thank you, Mr. Chair, distinguished guests, ladies and gentlemen. Hong Kong, China endeavors to strengthen health security for all. We appreciate the excellent effort of the WHO teams in coming up with the draft Asia-Pacific Health Security Action Framework, which provides practical guidance and best practices on how to enhance our preparedness and readiness to pandemics and also emergencies. We welcome and endorse the action framework. Hong Kong, China is committed to implementing the action framework with the international health regulations and its core capacity requirements. To fulfill our international obligations, other than joining the technical meeting on this draft action framework, currently we have also actively participated and been involved in the technical consultations organized in Hong Kong by WHO on public health and social measures for mitigating the risks and impact of epidemic and pandemic influenza. We believe public health emergencies and epidemics can only be tackled with close regional and international collaboration. Hong Kong, China stands ready to support WHO and member states on this front. Our public health laboratory is one of the WHO reference laboratories providing confirmatory testing support in the region for several pathogens and diseases, including SARS-CoV, influenza, measles, tuberculosis, etc. During the COVID-19 pandemic, our public health laboratory was the first institute in the world to upload the whole genome sequences of the Omicron variant to the International Genome Database, which contributed to the global surveillance of variant strains and subsequent vaccine development. Mr. Chair, drawing reference from the COVID-19 experience, we would like to highlight the importance of health innovation under the Health Information System and Health System Resilience outlined under the action framework. It is an indispensable and critical tool to ensure the success of health security. Innovative health technology platforms have expedited vaccine and therapeutics development, enhanced logistics and diagnostics use, supported new modes of surveillance, including that from drainage, genomic surveillance, facilitated epi investigations, contact tracing, port health control, and so forth. So noting that there will be another agenda item on health innovation, we believe cross-referencing the action framework with the upcoming regional health innovation strategy for the Western Pacific will be of paramount importance. And given the diversity of this region, how to apply health innovation to support health security in different economies require WHO coordination and guidance. Mr. Chair, ladies and gentlemen, Hong Kong, China look forward to working closely with WHO and other member states in this region to advance health security. We support and endorse the Asia-Pacific Health Security Action Framework. Thank you.
Thank you. I call on representatives of the United Kingdom to be followed by Fiji.
Mr. Chair, thank you. The United Kingdom thanks the Secretariat for this paper. We'd like to thank the WHO Western Pacific and Southeast Asia regional offices and all stakeholders for their coordinated approach in the development of the draft Asia-Pacific Health Security Action Framework. This is a key tool to facilitate a more integrated and inclusive approach to health security. The UK welcomes the framework and fully supports WHO's leadership on health emergencies. The challenges of emerging and re-emerging infectious disease, climate change, and extreme weather events are complex, and it is critical that WHO continues to strengthen its support to member states in preparing for and responding to polycrises. In the implementation of the framework, it will be important that WHO and partners coordinate effectively with other regional actors to ensure a coherent regional approach to preparedness. Global health security is a key priority in the UK's recently launched Global Health Framework. We recognise the growing threats to public health in the region, and building on our partnership with WHO and initiatives such as the UK Department of Health and Social Care's Fleming Fund to address antimicrobial resistance, the UK is currently scoping new partnerships to build preparedness for health emergencies in the region. We will create more opportunities for mutual learning and exchange between the UK and actors across the Asia Pacific on this important agenda. The draft framework, alongside other relevant regional frameworks, will directly inform UK cooperation in the region. Thank you.
Thank you. I call on the representatives of Fiji to be followed by Samoa.
Thank you, Honorable Chair, Acting Regional Director, and honorable members of the forum. Fiji acknowledges and thanks the Secretariat for the draft Asia Pacific Health Security Action Framework before us. We also note the progress report on health security. Our health specialists have contributed to this document at various consultation forums undertaken for the framework, and we are satisfied that the scope of the framework will ensure that our national and regional pandemic preparedness, prevention and responses are geared to deal effectively with future health threats. In Fiji, with the support of the Office of Pacific Technical Support, we are pursuing the review of the definition of disaster in our legislation so that health emergencies and pandemics are included in the definition of disaster. This will allow for immediate access to Fiji's whole of government approach to disasters that are mandated under Fiji's Natural Disaster Management Act 1998. We are hopeful for a successful outcome in this review. We acknowledge WHO for the support that has allowed Fiji to continue on behalf of our SIDS in the Pacific to engage and contribute at the current negotiations of the member state working group on amendments to the international health regulations, as well as the intergovernmental negotiating bodies for the pandemic treaty. Fiji believes that these negotiations are critical for SIDS and LMICs as issues of equity in access to information, diagnostics, intelligence, medical interventions are necessary for the protection of our population and our effective response to future health calamities. We call on our more developed member states in the WPRO region to support our push for equity at these negotiation forums. We also look forward to the support of WHO and our partners for our continuing engagement in the negotiations. And I stress that we invite our Pacific members to please join Fiji in this effort. Fiji is feeling fairly lonely at the moment in the negotiations. Lastly, Fiji is looking forward to the recertification of the Fiji Emergency Medical Assistance Team in 2024. We are in our preparation phase for this important event, and we call on WHO and our partners to support Fiji in this important quest. This will provide many benefits for disaster response capacity, both within Fiji and in the region. Thank you, Chair.
Thank you. I call on representatives of Republic of Korea to be followed by Vietnam. Sorry, did I make a mistake there? I call on the representative of Samoa to be followed by Republic of Korea. My apologies.
Thank you, Mr. Chairman. I thought you forgot about Samoa, but it's good you come back. Greetings to you all, Talofa Lava from Samoa. Samoa would like to applaud our regional office for compiling the draft Asia Pacific Health Security Action Framework as a guiding tool to further strengthen our region's effort to enhance health security, not only at the regional level, but most importantly, at the national level. Samoa's experience from measles epidemic in 2019 and COVID-19 global pandemic in the past 3 years reminded us that health security is not just the Ministry of Health and health sector's responsibility. It is the responsibility of every individual, from our government leaders to our community. We have noticed the unpredictability of public health emergency occurred from time to time. And if we are not well prepared with our preparedness and responses in terms of enhancing health security at national level, we will experience major problems which not only affect our health, but also our economic and social status like what we had experienced during COVID-19. Hence, Samoa fully support the endorsement of the proposed Asia-Pacific Health Security Action Framework, which not only portrays WHO technical support to us, member states to strengthen our health security systems, but also highlight the importance of working through whole of country and multi-sectoral approaches at the national level to implement programs and activities that foster health security. Thank you very much, Chairman.
Thank you. I call on the representative of Republic of Korea to be followed by Vietnam.
Thank you, Chair. The Republic of Korea appreciates and supports the WIPRO for their hard work to prepare the draft Asia-Pacific Health Security Action Framework. The impacts of public health emergencies and the significance of preparedness for and response to the emergencies have been globally recognized. The COVID-19 pandemic has raised public awareness of the importance of boosting health security capacities. As COVID-19 pandemic is over, I believe now is the time to use this momentum for creating opportunity to take political decision and make long-term investment. From the same perspective, last September, the UN high-level meeting adopted the political declaration on pandemic prevention, preparedness, and response. With member states expressing its support, the declaration contains the need and urgency of continuous financial support for pandemic preparedness. Since an outbreak of MERS in 2015 in Korea, we have reformed infectious disease control system, which enabled us to better respond to COVID-19 based on accumulated experiences and infrastructure in place. I believe that countries around the world need to be prepared for multiple health emergencies occurring simultaneously, and such complex emergencies require multi-sectoral response. Based on that understanding, we take a whole-of-government approach and made medium and long-term plan to prepare for another pandemic. Establishing and implementing global, regional, and national level plan to tackle health emergencies will help build an environment safer from health emergencies. Currently, KDCA, Korea Disease Control and Prevention Agency, is working with WIPRO towards its designation as WHO Collaborating Center on Pandemic Preparedness and Response based on Asia-Pacific Health Security Action Framework, and which is expected to greatly contribute to enhancing health security capacities of the Western Pacific going forward. As part of our efforts to advance regional health security, with Global Health Security Coordination Office to be established, the Republic of Korea will be committed to strengthening regional and global health security. Thank you.
Thank you. I call on representative of Vietnam to be followed by Vanuatu.
Mr. Chair, Honorable Minister, ladies and gentlemen, Vietnam highly appreciates the WHO Western Pacific Region Committee's leadership and efforts in supporting regional pandemic prevention, preparedness, and response in the past years, and also the health security priority and advancing health security capacity and system in the region. Vietnam thanks all member states for close support on this area. To continue making progress in strengthening the national system to prevent, detect, prepare for, and respond to health security threats, Vietnam has implemented a series of necessary activities, which including the identification, the national strategic assessment of the public health risks and threats, development contingency plan, enhance the surveillance and detection, as well as foster the emergency response capacity and capability. These activities has engaged by on relevant stakeholders under the umbrella of Vietnam One Health Partnership. Finally, Vietnam appreciates and support for endorsement a large number of given technical guidance and has considered in the draft of Asian Pacific Health Security Action Framework into account for continued enhancement of our national health security. We look forward to working with our member states and partners. I thank you all.
Thank you. I call on representatives of USA territories to be followed by the United States.
Thank you. Thank you, Chair, Ministers, Delegates, Representatives. The United States territories support the proposed framework of WIPRO to ensure the health security of all, especially those hard to reach, underserved, and most vulnerable. We are encouraged the proposed framework builds upon progress already made and reaffirms a prioritization of health security, allocation of necessary resources, and advocacy for international cooperation in the Western Pacific region that is critical to solidarity and international security. COVID-19 brought vital lessons to the territories to develop a robust disease surveillance systems to detect and track outbreaks early, allowing for swift response. More work is needed in furthering investments in healthcare facilities, equipment, and healthcare workforce to enhance the region's capacity to respond to health emergencies, building upon member states' collaboration to share information, resources, and expertise in addressing regional health threats. We are particularly vulnerable to public health emergencies with a complex mix of environmental threats and challenging economic realities. We continue to require integrated approaches from multi-sectorial health security systems to further strengthen our capacity to detect, report, and respond to health emergencies. Health security is critical to ensure we are prepared to manage health threats. In the space to implementing innovative approaches to address health security challenges, we offer a travel card, a concept that incorporates health status as part of travel requirements. This does not prevent a traveler entering our countries. It would serve as an additional screening tool of travelers to prevent their introduction of diseases that could further strain our already fragile healthcare systems. American Samoan and in absentia, Commonwealth of the Northern Marianas, and Guam support the opportunity to work together for continued support on health security. Thank you.
Thank you. I call on the representatives of the United States of America to be followed by Kiribati.
Thank you, Mr. Chairperson. The United States thanks WIPRO for its continued work in ensuring health security for all, especially the most vulnerable and hard to reach. We endorse the proposed framework as written. We recognize the COVID-19 pandemic exposed gaps in many health security strategies. Furthermore, we reaffirm that global health security is vital for international security and solidarity and cannot be achieved alone. We are encouraged that the proposed framework builds upon regional progress already achieved under OPSED, incorporates regional experiences and critical lessons from COVID-19 and avoids duplicating the role of other instruments and forums. We also celebrate that the framework represents a nimble tool for all member states, especially small island developing states, which is built on a foundation of equity, inclusivity, and coherence. The United States has long supported global health security work and has committed to provide financial support and technical assistance to strengthen countries' capacity to prevent, detect, and respond to infectious disease threats. For example, the United States was instrumental in launching the International Global Health Security Agenda Initiative in 2014 and the Pandemic Fund Financing Mechanism in 2022. But we acknowledge that we can still do more to promote health security. The United States, working with the WHO, commits to initiate and conduct a renewed external evaluation of U.S. health security and pandemic preparedness capacity by the end of 2024, using the new Joint Evaluation 3.0 tool and in line with our strong commitment to the international health regulations. We encourage WIPRO member states to consider undertaking their own JEEs to identify needs and opportunities and promote transparency and accountability in health security. We have also committed to support the planned Global Health Security Coordinating Office being established by our colleagues by the Republic of Korea, and also establishing the U.S. Centers for Disease Control and Prevention's new East Asia and Pacific Regional Office based in Japan. We encourage WIPRO member states to continue leading the world in global health security and endorse the proposed framework. Developing and strengthening health security capacity and capabilities requires a global effort, weaving together existing methods and implementing innovative approaches to address health security challenges. Thank you.
Thank you. I call on the representative of Kiribati to be followed by Papua New Guinea.
Honorable Chair, honorable ministers and delegates, ladies and gentlemen, Mary and greetings to you all. With the COVID-19 pandemic slowly receding into memory, it is normal for many of us to relax and become complacent. However, this framework is a good reminder to us all of our continuous vulnerability to public health emergencies and therefore the need to strengthen and enhance multi-sectoral health security capacities and systems to prepare, respond, and to increase resilience to multi-hazard public health emergencies. I would like to take this opportunity to thank WHO and WIPRO office for the continuing efforts to ensure that our region is prepared for and resilient to public health emergencies through collective action, and for coming up with this new health security framework. In terms of natural disasters, we're fortunate in Kiribati that most of the risks we face from natural disasters are the less acute hazards arising from sea level rise, coastal erosion, droughts, saline intrusion, and ecosystem degradation. However, there's a lot of unfinished business when it comes to readiness and strengthening resilience for infectious disease outbreak. As we all know, our low mortality rates from COVID-19 were not due to having strong and well-prepared health systems during the pandemic. If an IHR capacity assessment had been done just before the pandemic reached our shores, my country would have scored very low. But we were fortunate that we were able to delay the virus from reaching our shores through border closures, which allowed us time to achieve good vaccination coverage for population and prepared our facilities, staff, and prepared us to stockpile PPE supplies. We acknowledge the importance of taking on a multi-sectoral approach when it comes to health security. However, I want to point out that our health-specific systems remain weak and will require strengthening. We take note and thank WHO for the recommendation in Part 4 of the document, which states that WHO will develop an implementation guide to support countries with technical guidance and suggested priority actions for the domains outlined in the framework. Kiribati welcomes support for an in-country long-term advisor on health security through WHO or through the kind generosity of larger member countries of WIPRO to support us address our health security gaps. Ladies and gentlemen, Kiribati endorses the draft Asia Pacific Health Security Action, and we look forward to working with WHO and partners to implement it at country level.
Thank you. I call on the representatives of Papua New Guinea to be followed by Palau.
Thank you, Chair, Your Excellencies, colleagues, ladies and gentlemen. Papua New Guinea acknowledges and supports the Health Security Action Framework for the Asia Pacific region. Papua New Guinea is vulnerable to public health emergencies caused by disease outbreaks, disasters. Some of the emergencies are expected to increase in frequency, magnitude, intensity due to climate change. PNG experienced disease outbreaks and natural disasters in the last 10 years. PNG, like many other countries, is exposed on vulnerability and tested our preparedness and strengths and weaknesses. To manage the pandemic, PNG developed a Pandemic Act of 2020, which empowered the establishment of the National Control Center in 2020. Department of Health has developed the COVID-19 forward plan to downgrade. Now that it's downgraded the pandemic and integrated back to National Department of Health. The country has also addressed health security with the following interventions. We've developed the structural change in the Department of Health to restructure and elevate our disease control and emergency response unit to health security branch. We've also done a health security national action plan, and it's ready to be for consultation. We also doing a field epidemiology training for 3 months for our provincial officers on frontline officers, which draws participants from animal, plant, and environmental workforce, as well with aim to strengthen collaboration and improvement in surveillance, detection, reporting, investigation, and also response. We've established national and sub-national emergency operating centers, or called EOCs, and trained multidisciplinary rapid response team at our national and provincial levels. We've also established case definition for influenza to incorporate COVID-19 as integrated respiratory illness surveillance system, building an existing sentinel surveillance for influenza. PNG established the Intersectoral Committee on Antimicrobial Resistance to address AMR issues and One Health in a country. PNG is also advancing into establishing its National Reference Laboratory as a step towards establishing a public health institute to address health security preparedness. And PNG, through its National Health Plan 2021 to 2030, promotes and transfers health ownership to the community to prevent and participate in health security preparedness and also awareness. With this, more work needs to be done, and PNG, therefore, PNG appreciates and supports WHO and all our stakeholders in assisting with addressing health security in the country, and hereby supports the movement to endorse the draft Asia Pacific Health Security Action Plan. Thank you, Chair.
Thank you. I call on the representative of Palau to be followed by Tonga.
Honorable Chairperson, honorable ministers, esteemed colleagues, ladies and gentlemen, good morning. Health security in our region remains a paramount priority as our achievements in addressing all health challenges that we face directly collaborates with our level of preparedness and resilience. It is imperative that we, as individual member states and as collective region, to identify, capture, and learn from the lessons of COVID-19 pandemic, both in terms of failures and successes with our responses. It seems that over the last 2 years, as the severity and the impact of the pandemic subsided, so too has our focus, attention, and willingness to evaluate our response efforts, regardless of the reason, be it human nature, also called COVID fatigue, that discourages us from revisiting discussion on the pandemic. It is nevertheless imperative that we undertake the task as necessary if we wish to better be prepared for the next pandemic or any other emerging or re-emerging public health threat. With our case in Palau, we are able to make efforts to undergo pragmatic, deliberate, and thorough review of our COVID-19 response, citing that after action reports, plans, and lessons learned with the intent of maintaining readiness, rapid resource mobilization, and response. In line with this, in June of last year, we established our first national emergency management team, Team Clamat, making Palau the smallest country in the world by population to have such a team established at the time. Most recently, on October 1st, Team Clamat has activated and served as a medical team for the Independence Day celebratory events in Palau, which, although not an emergency or a disaster, nevertheless served as a training priority for the team to experience and implement response plans and procedures. Further to the lessons learned on the standard components of emergency preparedness, response, and disaster management, we realized the importance of capturing the lessons learned in other areas, including logistical, procurement, and success and challenges with risk communications, community engagement, mental health, and workforce resilience during emergency and disaster response. With this, Palau supports and endorses the Asia-Pacific Health Security Action Framework with emphasis on prioritizing workforce capacity, capability, mental health resilience in order to maintain and enhance health security in our region. Thank you, Mr. Chairperson.
Thank you. I call on the representative of Tonga to be followed by Cook Islands.
Honorable Chair, Acting RD, and distinguished delegates, Maloi Lele and warm greetings to you all. Public health emergencies regularly impact the 1.9 billion people in the Western Pacific region, often overwhelming fragile health systems. Recently, outbreaks, typhoons, cyclones, earthquakes, and other disasters have caused significant mortality and morbidity, particularly affecting vulnerable populations. During the COVID-19 pandemic, extensive economic losses came to the fore due to closure of borders, disruptions in supply chains, and travel limitations. Often public health emergencies occur concurrently and have a multiplier effect on the economic, health, and other paradigms. In my country of Tonga, the COVID-19 response could not be completely separated from the Hunga Tonga Hunga Hapai volcanic eruption and tsunami, which occurred only 2 weeks prior to the onset of our first COVID-19 community transmission. The volcanic eruption and tsunami severed communication lines when the country most needed them and affected nearly our entire population. Nonetheless, the Tongan people showed tremendous resilience, and the Ministry of Health implemented contact tracing, case finding, and rapid response with guidance from the Joint National Emergency and National COVID-19 Committee teams. While our National Emergency Medical Team, the Tonga Emergency Medical Assistant Team, TMET, deployed to Hapai to care for those affected by the tsunami. With effective public health actions and nearly 90% of our eligible population vaccinated, COVID-19 mortality was relatively low, and we were able to focus resources on simultaneous COVID-19 and tsunami recovery efforts. The keystone to next steps is an improved country-level coordination through a public health emergency operations center with a clear incident management structure and communications mechanism nested in our National Emergency Management Office. Wipro have been working on the draft Asia Pacific Health Action Framework, which has included lessons learned from COVID-19 and areas for improvement, building upon the last health security framework, EPSET 2, founded on core values of equity, inclusivity, and coherence to guide policy and practice. It provides a collective approach for countries and areas in the Pacific region. A resilient health system must include the ability to maintain essential health services and respond to health emergencies. A strong and equitable health system is resilient in the face of potential threats. Tonga commends and supports the new framework, further seeking support in its implementation. Member states can use the same for preparation of future pandemics and public health emergency. I thank you, Honorable Chair.
Thank you. I call on the representative of Cook Islands to be followed by Vanuatu.
Kia ora, and a warm Pacific greeting. Kia ora, Chair, and a warm Pacific greetings to all honourable ministers, distinguished delegates, officials, development partners, ladies and gentlemen. The effects of climate change, pandemic outbreak like COVID-19, and the ongoing civil conflicts in some parts of the world are affecting the health security of our people within the region and globally. The increasing need to respond effectively to new threats or risk to public health is timely, as the 2005 Asia-Pacific Strategy for Emerging Disease and Public Health Emergencies have served its purpose. The new development of the draft Asia-Pacific Health Security Action Framework is timely to escalate our collective collaboration, investment, and response to future public health emergencies. This calls for the need to strengthen resilient health systems and facilities and integrating health security in primary care settings for universal health coverage to leave no one behind. And in our Cook Island language, we say, "Aura karabatetai ki ahangarpoi na ia." So the Cook Islands gives its full support to the endorsement of the Asia-Pacific Health Security Action Framework. The Cook Islands calls on development partners to be flexible in their approach and support for technical and general support to countries in need. This includes for a streamlined application process for support from the Green Climate Funding and others to strengthen health system resilience and facilities strengthening initiatives. I also echo the commitment by the Pacific Health Ministers to strengthen health systems resilience at its recent 15th Pacific Health Ministers meeting in Tonga. And in closing, I would like to thank WHO for the ongoing support for health system strengthening initiatives for the Cook Islands, and ADB for the extra new consultation rooms that will be opened very soon next month, and also thank the support of other developing partners. Meitaki Chair, thank you.
Thank you. I call now on the representative of Vanuatu.
Thank you, Honorable Chair. Greetings to you all delegates participating in this important session. First of all, on behalf of the Republic of Vanuatu, I would like to thank the WHO for organizing this very important meeting. The Republic of Vanuatu remains vulnerable to disease outbreaks, environmental and food-related emergencies, and the health consequences of disasters such as cyclones, coastal erosion, and inundation, floods, landslides, droughts, volcanoes, earthquakes, and tsunami. In March 2023, Vanuatu had 2 cyclones that made landfall within 3 days apart. More than 80% of the population has been affected and is slowly recovering from the impact of these cyclones. The challenges of COVID-19, severe tropical cyclones, and concurrent outbreaks has highlighted the critical importance of continuing emergencies, preparedness, and readiness, and to ensure the community of essential health services during emergencies through a strengthened national capacity for coordination and response. Disruptions to travel, trade, and tourism brought to us so by COVID-19 further emphasize the need for national resilience. Our population also faces an uncertain future due to climate change and the ever-present threat to natural disasters. There is ongoing need to strengthen and sustain national capacities in preparedness, readiness, response, resilience, and recovery using an all-hazard approach. In Vanuatu, where the human resources for health are particularly limited, it is often the same health staff managing public health emergencies and responding to the health consequences of disasters. In this context, we are examining how best to integrate and streamline efforts to ensure sustainability and resilience through the development of the National Action Plan for Health Security. WHO has been a key partner to the government of Vanuatu in planning, preparing, responding, resource mobilization, and capacity building during emergencies. We thank the WHO Secretariat for drafting in a consultative way to Asia Pacific Health Security Action Framework, designed to further enhance the engagement of multi-sectoral stakeholders in collaborative approaches to strengthen resilient health security systems, with a scope that also emphasizes the links between health security and process towards universal health coverage and the Sustainable Development Goals. We therefore fully support the endorsement of the draft Asia Pacific Health Security Action Framework. Thank you, Mr. Chair.
Thank you. Are there any more representatives who wish to speak on this topic? If not, I understand that there are representatives of non-state actors who wish to make a statement to the committee on this agenda item. Both written and oral statements will be uploaded to the designated webpage, RCM webpage, and the meeting app. As statements reflect solely the views of the non-state actors concerned, it follows that statements do not necessarily reflect the views of the World Health Organization, including its member states and secretariat. It is my pleasure to call on the representative of Women in Global Health, Inc., to be followed by the representative of International Federation of Pharmaceutical Manufacturers and Association to deliver a short statement to the regional committee. You have the floor.
Good noon. I am Pura Angela Ko, speaking on behalf of Women in Global Health Philippines. So we commend the committee and the draft Asia Pacific Health Security Action Framework for recognizing gender equity as a key health security issue. So women constitute 70% of the health workforce and 90% of frontline health workers. They were our frontliners, raising community awareness, identifying cases, and contact tracing during the pandemic. Countries that performed better against COVID-19 were led by women, even though a mere 3.5% of national government COVID-19 task forces had gender parity. The pandemic exposed deep gender inequities that women health and care workers experience. In many countries, the majority of COVID-19 infected health workers were women. Women health and care workers were exposed to greater risk of infection as personal protective equipment is designed on male bodies and physiology. The pandemic has also left a legacy of great resignation and migration of health workers that has reached crisis level in some countries. This needs to be addressed to safeguard health systems and global health security. Therefore, Women in Global Health Philippines calls for, first, enabling policies, systems, and processes that will ensure gender parity in leadership for women health workers in governance, decision-making bodies, and advisory committees related to health security at all levels. Second, allocating budget for health systems that ensure frontline and community health workers have properly paid jobs and that there is the capacity to resource surge efforts and services. Third, committing to providing safe and decent work environment for women health workers that includes fit-for-purpose PPE and combating workplace harassment. Finally, addressing the mental health needs of health workers, especially women who manage heavy workloads during pandemics while delivering additional and unpaid domestic responsibilities. Thank you.
Thank you. I call on the representatives of International Federation of Pharmaceutical Manufacturers and Associations.
Thank you, Chair. IFPMA welcomes the opportunity to provide comments in relation to this agenda item. The COVID-19 pandemic, the ongoing antimicrobial resistance crisis, and climate change-induced extreme weather events, among others, all serve as a reminder of the need for global, regional, and national prevention, preparedness, readiness, and response to these increasingly common multi-hazard public health threats. The recognition by the Asia Pacific Health Security Action Framework that health security is everyone's business, and the need for strengthening multi-sectoral coordination, including with the private sector, are important for developing and implementing robust health security frameworks. When responding to public health threats, a resilient, sustainable, and high-quality private sector in the health and life science industry is critical for the development, manufacturing, supply, distribution, and availability of medicines and other health technologies, such as vaccines, medical devices, and diagnostics. To support a sustainable innovation ecosystem, policies need to focus on several factors, including stable rule of law, open trade, and a business environment backed by sustainable financing, as well as robust intellectual property protections that promote voluntary collaborations. Thank you.
Thank you. May I now call on the Secretariat to respond to the points that have been made? Thank you.
Thank you very much, Chair, and also to the delegates for their, considered responses to the Health Security Action Framework. I think there were many comments. So what I would do is I will just pick up on some common threads and respond to those. I think we really welcome the comments on the importance of the One Health approach and the need for coordination, a multi-sectoral approach, as well as a whole of society approach. And we will continue to work towards that. There were comments regarding the implementation process, and we will be looking at developing an implementation guidance that will be available for consideration in Q2 of 2024. The action framework itself, when we look at the national action plans for health security that are to be developed by member states or their equivalent, then the health security action framework does provide a framework within which member states can develop their national action plans and incorporate findings from the IHR monitoring and evaluation framework components, such as the JEEs, which were mentioned, and we would really commend to member states that they consider those. Clearly, this has been noted by some of the member states. Samoa will be doing one in a few weeks' time. Mongolia will also be doing one this year. And other member states have already highlighted that they are going to do JEEs in 2024. And so this process will be supported by WHO. And of course, then implementation of the framework can be incorporated into those national action plans. We, of course, recognize the need for equity, and this is again embedded within the document itself, and the ability for member states to access innovations such as new vaccines, new drugs, and various countermeasures is very important. And again, we would support that. There were comments again on how we can support member states to implement the activities, and we will work together with donor partners and others to seek assistance and support for member states, particularly those in the Pacific Island countries. The pandemic fund has finished its first round, and there will be a new round coming up. And again, we will organize as much as possible with member states consultations around how we can better help and support them to improve their bids and look towards success in that particular area with regards to obtaining funding. There was a comment from several of the member states regarding establishment of a CDC, and Tuvalu, your comment was noted, and we will next year be holding a consultation on establishment of CDCs. And so this is something that we are going to progress together with our colleagues from headquarters. In addition, there was also mention with regards of whether the APSAF is consistent with the approach of other frameworks, global frameworks. I'm happy to say yes, it is. We went through all the current global frameworks to ensure that we were aligned with those. And so you will be able to see some crosswalking if you want to have a look at that. We continue to monitor the INB progress as well as that of the working group in IHR to determine whether we would need to make any amendments to our APSAF, and of course this would have to be considered at our technical advisory group, and I'm happy to say that that will continue to meet and to provide guidance on how we support member states within the region, how we learn from the experiences of any further events that do occur, and also then on how we can continue to act together in solidarity and to also ensure that we do not leave anybody behind. So, Mr. Chair, thank you very much.
Thank you very much, Chair.
Let me just join Dr. Olovokur and thank member states for your continued support and commitment to strengthening health security in the Western Pacific region. The Asia-Pacific Health Security Action Framework builds on 2 decades of achievements and investments in public health, emergency preparedness and response. And the framework will definitely support member states in your efforts to build stronger and more resilient health security systems to safeguard the health and well-being of the people in the region. The Western Pacific region will continue to face disproportionate number of threats to public health. These threats are becoming more complex due to modern dynamics like including travel, migration, urbanization, environmental degradation, and climate change. And now more than ever, health security requires forward-looking approaches that are comprehensive, integrated, and intersectoral. And the endorsement of the Asia-Pacific Health Security Action Framework is a critical step towards this vision of the Western Pacific region that is prepared, ready for, and resilient to public health emergencies through solidarity and collective action with the aim of achieving health equity. So let me thank to all of you, and let me thank to our colleagues, Dr. Olovokur and his team, for developing this and consulting the member states throughout the process. Thank you, and back to you, Chair.
Thank you, Dr. Olowokur and Dr. Jacob. If there are no further comments, may I request the rapporteurs to draft an appropriate resolution? That concludes our consideration of this agenda item. Thank you very much. And before we break for lunch, may I take this opportunity to remind distinguished representatives that the written notes that they used to make the statements are very helpful to the report writers. A request for confirmations of the name of the speaker and for the written notes will be handed to the representatives by conference staff. We appreciate your help in providing this information. During the lunch break, there will be a side event on transformation of the regional office, including organizations and workplace culture change at 12:50 hours here in the plenary hall. When we resume after lunch, we will move to item 10, the panel discussions on charting the course, rethinking health financing for social well-being and sustainable development. And this will be followed by item 16.6 on the rules of procedure of the regional committee. Thank you, and see you when we reconvene at 1400 hours this afternoon. Thank you very much.
Thank you.
Sorry, no, I'm fine, Friday. Use it when talking to other people. When I say, look.
Hello, ladies and gentlemen. May I suggest that you take your seat, please? I hope that some more delegations will come and join us because we are now discussing the transformation at the regional office. And it's an important piece of work, and I'm sure that member states also want to listen to it, although it will also be formally and officially on the agenda of the regional committee later today. This is more the informal session together with our colleagues in the regional office and country offices to give you the impression of and insight of what we are really doing here. So first of all, thank you for attending and welcome. Thanks also to the regional director nominee or elect to be here with us today. And welcome. And today we would like to report to you on progress on this transformation agenda, which is rooted in the principles of inclusivity, respect, and collaboration, with the aim to create a modern WHO that makes the difference or makes a difference in the lives of people. Our strategic objective is to unlock the full potential of WHO and of our staff. And therefore, the Western Pacific region has embarked on multiple initiatives with the aim of driving forward this change to make our workplace safe, respectful, and impactful. Today, you will hear from our colleagues who are here with us today on the workplace culture and organizational change, behavioral change initiative, on the zero tolerance policies, including our work towards the WHO Values Charter, on the prevention of sexual misconduct, on psychological safety, and strengthening our impact in the region. You will also be hearing from our colleagues as we highlight ways this journey is impacting our workforce and the work in the region. So first, please allow me to invite Mrs. Laura Davison to lead us through our work on the workplace culture and organizational change in the region. Mrs. Davison is the Executive Officer for the Regional Director's Office and the overall lead for the workplace culture. Laura, you have the floor.
Thank you so much, Dr. Jakob. As many of you know, at the beginning of 2020, WHO in the Western Pacific region embarked on a journey to strengthen and improve our workplace culture in order to enhance our ability to serve all of our member states. We've been through a lot, and we've done a lot in that time. We've been working hard to improve the region's workplace culture across a range of different initiatives. One of those that we'd love to tell you about today has been our Values in Action dialogue. This is a series of discussions based on the WHO Values Charter, which you can see on the screen before you. We use this module as a basis for discussions about how to, considering the WHO values, how we could align our everyday behaviors and actions within the workplace, but also the personal values that we bring along to our work. So enough from me. I wanted to share with you and introduce our colleagues from the Division of Health Systems and Services who've been deeply engaged in this initiative. So please allow me to introduce Katrina Bernardo and Zhao Li to tell us about how this has impacted them.
Thanks, Laura. In the regional office, everyone from the Division of Health Systems gathered to connect and reflect on various areas, including the role of the division in supporting member states and the importance of the WHO Values Charter.
The values of the WHO workforce reflect the principles of human rights, universality, and equity established in the Constitution, as well as the ethical standards of the organization. Understanding the importance of this, we took the time to review the WHO values during a division retreat in late 2021 and took time to collectively outline how we would put the WHO values into action.
To make it happen, the division put together a working group that was representative of division staff across grade, gender, and contract types. The aim of this group was to develop a living document that spelled out how DHS would walk the talk or put our organization's values in practice.
And this is how the DHS Cares Values Agreement was developed, as you can see on the screen. The approach to developing the DHS Cares Values Agreement was underpinned by the principles of co-creation and grounds up. However, we had also clear support from the division director and our colleagues, with all technical units committed to executing the agreement into actions.
The working group reviewed the WHO values, and for each WHO value in the charter, we developed 5 actions that aligned with the division. We then used surveys and other forums for colleagues to vote on what actions best fit the division and the values charter, and to also gain feedback and suggestions.
And while there were both positive and negative views, we ensured that everyone had a voice in developing the values agreement, and also ensured the feedback mechanisms were safe and anonymous.
The DHS Cares is a division's commitment to practice the WHO values to enable and nurture a happy and healthy workplace.
So this value agreement includes 15 actions underpinned by the WHO Global Values Charter. Not only does it work to build a respectful workplace culture, but also outlines how DHS can work together to support our member states.
We feel the impact of this agreement every day throughout the division in how we interact with others, from the small things to the larger cultural shifts. For example, during our monthly division meetings, we model being persons of integrity by each technical unit having the time after their technical updates to have a quick shout out to anyone in the division to express thanks and gratitude that have embodied our values in action. It's a small gesture, but it goes a long way in recognizing each other's efforts and contributions. Plus, it brings a lot of positivity to our division. And let me tell you, those shout outs always end up with a bunch of likes and heart emojis.
And aligning with the WHO values of people caring about people, our work as a division to raise awareness of the importance of a respectful workplace has led to colleagues being more respectful towards each other and more conscious of each other's time. For example, non-urgent emails outside of the working hours are limited. And now that with the world being opening again, we've brought back the tradition of bringing local snacks and treats for everyone whenever someone goes on a trip. And this is how we share the gratitude and calories and also happiness.
Being collaborative colleagues and partners is a value that the division strives to do with all our partners and within the division. We work as one DHS team and pursue opportunities to collaborate for a greater impact. As a result, we generate unity among and between units. Our impact, productivity, and performance levels are higher, but without compromising our work-life balance, and uphold mutual respect while doing so.
So in line with the value of the professionals committed to excellence in health, we recognize that we must be adaptable and open-minded to change when presented with the new evidence. With this, DHS Cares Values Agreement is planned to be reviewed and constantly at team and division meetings, and new colleagues to the division are briefed on the agreement.
Together, the DHS Cares Values Agreement empowers us to be trusted to serve public health at all times. Each of the units was also asked to develop its mission statement on how they contribute to health system strengthening and the overall mission of DHS, and have a clear impact at the country level.
So our next phase is the continuous realization of our vision. And this includes looking into what tools and approaches that can further implement a stronger DHS workplace culture and what we can do to sustain the momentum, ensuring that we build upon our existing foundation rather than starting anew. By doing this, we aim to create a more vibrant and supportive environment and where we can all thrive and contribute to the success success of WHO. Thank you very much. And now, Dr. Jacob, I'm sorry, the floor is yours.
Sharing with us. Thank you very much, Laura, Zhao, and Katrina, for sharing with us how our region is taking steps to understand what our WHO values charter looks like in our day-to-day actions and interactions. The WHO values are linked to a larger package of policies that relate to matters of conduct with the aim of building a fairer, safer, and more respectful WHO. To speak more about our work regarding zero tolerance and human resources, I invite our global regional human resource colleagues to speak. I understand that first I need to give the floor to our colleagues, Isabelita David Bellit. Colleagues, the floor is yours.
My name is Bellit David, and I stand before you today as a long-serving senior staff member in the administration. I have dedicated my life to the World Health Organization, starting my career here at young age of 18. Over the years, I have worked tirelessly, balancing work and studies to contribute to the success of the organization. I began as a contractual staff in the supply unit and then moved on to become a clerk in the travel unit. I have held various positions in the Administrative Services Unit, from temporary secretary to receptionist, switchboard operator, and inventory clerk. It was through my hard work and dedication that I was given the opportunity to apply for a regular position at WHO after graduating my college. In 2008, I was selected as a GSM trainer for the Pacific Island countries, which allowed me to develop new skills, gain valuable experience, and contribute to organizational learning. In 2010, I was fortunate enough to receive 2 promotions, a testament to my commitment to excellence. Thanks to the support of acting RD, HR, ASO, I was approved last July and released to do a regional short-term assignment in the Fiji country office, which allowed me professional growth in my career. HR also provided with a career coach who helped me guide me in my plan for further development, giving me the mindset to apply for a professional post. I am now applying for a P2 talent pool. Trusting my hard work and dedication will pay off in becoming a professional staff. Today, I am honored to be a part of WHO during this transformative period. Together, we have achieved a significant milestone, an 18.7% salary increase for G staff. This accomplishment is a testament to our collective hard work and dedication. I was part of the local salary survey committee. Through that journey, I learned the power of collaboration and importance of recognizing and utilizing the talents of every individual. Thank you for your time and for the opportunity to share my story.
Thank you very much. Thank you, Bellit. And with this, let me turn over to Rania Kargbo, who is our Regional Human Resources Manager. Over to you, Rania.
Thank you so much, Dr. Yakab, and thank you, Bellit, for sharing your amazing journey in Wipro. Your contributions are valued and respected. I am the Regional HR Manager, and I am only 16 months old in the role. What an incredible journey where I have spent significant part of my time in addressing the challenges posed by a transition to an agile staffing structure, a sudden change in leadership, and the daunting backlog in HR areas, a testament to the struggle faced during the pandemic. We can always do better, be better, act better, to improve, to remain competitive. I lead an exceptional team of skilled, dedicated, and positive HR professionals, some of whom are here in the room with me. Hi. We owe a tremendous debt of gratitude to Dr. Yakab, who continues to recognize the pivotal role of HR in WHO's mission. We have strengthened the HR structure the last year, now sit at the cabinet meetings where all leaders converge and part of the current workforce planning process. Collectively, under her leadership, we embark on a journey to build HR teams at the region and in the country offices that can truly respond to our current and future initiatives while we are maintaining a respectful, conducive work environment. As we discuss the concept of zero tolerance, it is crucial to recognize HR's role as the guardian of the rules and regulations, housing confidential files and information. We possess a wealth of knowledge about our personnel and should serve as strategic partners, working closely with the leadership and all staff to find solutions. We are duty bound to act in all areas and encourage all personnel, regardless of your designation, to continue to escalate all issues to us for guidance and support. I'd just like to highlight just a few of the HR milestones the last year. We've maintained an open door policy, enhancing access for all staff. We've automated numerous paper transactions and improved our response rate. We have quarterly calls with consultants, GS and NPO staff, and have bi-monthly 1 hour with HR sessions, clarifying policies, answering questions, and providing continuous support. We have made strides in promoting diversity and inclusion. We've hired and retained accomplished 9 women at higher levels, P5, D2, and USG, underscoring a commitment to gender diversity. We have the first ever female acting RD in Dr. Yakab. We acknowledge there is always more work to be done in creating a diverse talent pipeline, including more women at the director level, to name a few. We will mainstream DEI in all aspects of our work. Now let's talk about recruitment. We have promoted 69 staff members, with 85% of them in the general staff category. Over the past 18 months, we've successfully recruited 342 staff and 991 consultants, alleviating the burden on our dedicated team who have shouldered the workload during the pandemic. Significant investments totaling close to $500,000 have allowed us to offer extensive training programs. This includes zero tolerance programs, executive coaching, and leadership courses. We will roll out the local staff development program, the first of its kind, in November this year, and we're working on implementing a regional mentorship state program and several sessions on psychological safety in partnership with the Office of the Ombudsperson. We have 49 staff members who have benefited from developmental assignments, and in the mobility, we have 22 staff members willing to move and 11 recommended to be placed in vacant positions. We've taken a proactive approach by hiring an ombudsperson, a program officer for workplace culture, a PERSEA team lead, and a staff counselor. We have a regional staff physician, and are dedicated to mental health support is demonstrated through the global EAP program. Lastly, to our member states, we are very enthusiastic about visiting your countries and organizing career fairs, expanding the current Go WHO program. We have already visited China, Japan, the Republic of Korea, Vietnam, Fiji, and eagerly await your invitation. Today, together, we can ensure that the brightest minds are aware of the opportunities at WHO and can contribute to our mission. I would like to share a video about a one-week activity in Wipro focusing on zero tolerance, narrated by our colleagues Francesco and Ahmed from our Global Administrative Law Unit. Thank you.
WHO commitment to providing and promoting a working environment where the dignity of all staff members is respected is well documented in its policies and demonstrated in practice. In its policies, WHO has adopted a zero-tolerance stance on abusive conduct and sexual misconduct. It has provided a mechanism for addressing them when they occur. In practice, WHO has not hesitated to protect victims and taken resolute actions against any member of the workforce who was found to have engaged in such a conduct. WHO has also addressed disputes arising from abusive conduct and sexual misconduct in a timely and impartial manner through its internal justice system, which an external consultant found in a recent review to be functioning well. In this context, WHO has launched a robust communication campaign to remind its workforce of its duties in preventing and addressing abusive conduct, and also raise an awareness of its internal justice system. A part of this campaign, between 1st and 5th May this year, WIPRO hosted the first outreach mission in Manila, Philippines. The mission objective was to raise awareness among WIPRO staff members and management about the different zero-tolerance policies along with the work of internal justice system, so as to ensure the correct interpretation and application. For the first time in WHO, the mission was conducted with the participation of HR Talent Management Department, the Global Board of Appeal, and the Ombudsman. Let me pause here and thank the Acting Regional Director and her team for not sparing any efforts to make the outreach mission successful. My colleague Ahmed now will briefly walk you through the 5 days outreach mission in Manila.
During the 5-day outreach mission in Manila, the team had an in-depth discussion on the zero-tolerance policies and the internal justice system. Regional Director, members of her cabinet, and the staff association representatives. The commitment of all stakeholders to making WIPRO a safe and healthy workplace was clear. After meeting relevant stakeholders, we delivered a presentation on the zero-tolerance policies to an audience of staff members with managerial responsibilities, those without managerial responsibilities, and a special dedicated training for focal points who would in turn guide personnel on their work-related concerns long after we have left WIPRO. In addition, we co-delivered a training with the Ombuds and the Global Board of Appeal on the internal justice system, specifically focusing on the informal resolution of disputes, the administrative review process, and the Global Board of Appeals. We also distributed communication materials to raise awareness on our work. Lastly, we held one-on-one confidential session with WIPRO personnel where we heard their concerns and responded to their queries. The feedback we have received thus far from WIPRO personnel is that they are more aware of the protections available to them and the options for reporting abusive conduct and sexual misconduct. We laud the Acting Regional Director and her team for their commitment to providing and promoting a work environment where the dignity of all persons is respected, and for their effort in organizing a successful first outreach mission that has really set a good foundation for its replication in other regional offices. Thank you very much.
Thank you very much, Rania, and your team, your colleagues here, for the excellent and very overwhelming work that you are doing. And thank you also to Francesco and Ahmed from the Internal Justice Office in Budapest, and also to the Global Ombudsperson and the Chair of the Global Board of Appeal who visited us at the same time in spring. So with this, we move on. And as you very well know, the World Health Organization on a global scale maintains a steadfast stance of zero tolerance towards sexual misconduct, inaction against it, and also retaliation. And now I am happy to invite Dakshini Gunaratne, our Prevention and Sexual Misconduct Management Officer, to speak more about the activities on their way to create a more empowered workforce as a defense against sexual misconduct. Dakshini, over to you.
Thank you, Susanna. We in the Western Pacific region believe that if you want to achieve zero tolerance, we have to do it with kindness, empathy, and humanity. Our foundation is straightforward, yet very powerful. Every one of our colleagues, regardless of age, gender, sexual orientation, race or religion, or even the contract type, deserves and has an unequivocal right to work in an environment that is safe, respectful, inclusive, and above all, free from sexual misconduct. Last year, this meant that we prioritized giving all our colleagues opportunities to express themselves in spaces that were safe and non-judgmental. And as Rania mentioned as well, last year was when we intensified our efforts on prevention of sexual misconduct. And this year, as country office focal points, WHO representatives, and the regional country office team, we held focus group discussions and provided one-on-one confidential support for specific concerns. By November 15th, 2023, we expect that all our country officers will send in to us their PRESEA work plans, detailing how they aim to create safe and respectful workspaces in their environments. All country officers were encouraged, and by June 2024, all would have taken the opportunity to have 1 to 2 day retreats that were dedicated to PRESEA, and 1 to 2 week intensive long discussions on PRESEA touching all personnel. Currently, we have touched over 550 personnel in-person discussions. And the reason that we do this in such a prolonged manner is we believe that these discussions need time and the sensitivity to address them. And in this regard, I would really like to appreciate the support given to us, focal points by our WRs in our country officers, as well as the acting regional director. For without this space, none of this would have been possible. In all our endeavors, colleagues, today you will hear from our Fiji country office, particularly on their journey, and they will elaborate some of the points I mentioned. In all our endeavors, we prioritize the needs of those affected, as well as the rights of colleagues and implementing partners who are accused of sexual misconduct. We believe in empowering individuals, and as you will see from the Malaysia country office, what they have done as a country office in this regard. Additionally, we believe that in our future journey towards zero tolerance, all of us should have a voice. Together with the Division of Data Strategy and Innovation, we have encouraged colleagues to share their vision for a future WHO where sexual misconduct is no longer possible. And what is really interesting is some of the themes that came out of this visioning was that we felt that a future WHO where sexual misconduct was no longer there would be something that's represented by the words love, care, and family. And today you will hear the 3 of our colleagues who engaged in those visioning workshops speak to us about their experiences. Dear representatives of member states, today as our colleagues share, I urge you not only to listen to them, but really see them and hear the commitment that comes through their voices. Because in this region, we believe that we can only achieve zero tolerance if we go on this journey together. Now we will listen to our Malaysia country office, but before that, over to you, Mark.
Thank you, Dakshini. Ladies and gentlemen, colleagues and friends, Borvanaka, and warm greetings from the Division of Pacific Technical Support and WHO South Pacific Office. We're on a journey towards creating safer and more respectful workspaces, focusing on preventing sexual exploitation, abuse, and harassment. I'll now hand over to our active and committed PRESEA focal points who are connected online live from sunny Suva in Fiji, and who'll tell you a bit more about our approach.
Bula Vinaka, my name is Emma. While the support and endorsement of our leadership and management are important, it is even more critical to emphasize that we have been on this journey together. In the true spirit of the Pacific, we have united the strength of our entire DPS family our team coordinators, international staff, technical assistants, short-term consultants, and special services agreement personnel. Together, we are empowering and giving everyone the opportunity to speak, share experiences and insights, and learn from each other. Over to you, Sola.
Malodem, building on previous discussions this year, in July 2023, with a focal point in DPS working together with the PRESIA team in Wipro, we embarked on 2 weeks of focus activities which culminated in a 2-day workshop with our whole team. During the workshop, we gathered to Talanoa, where we had an open discussion about the issues, express our feelings and insights, and deepen our understanding of PRESIA. We organized focus group discussions, envisioning DPS as a safe and inclusive space with zero tolerance for any and all forms of sexual misconduct. The presence and active participation of our management team and all personnel, irrespective of contract types, reaffirmed our team's strong commitment and unified action towards this vision. Over to you, Dr. Nuha.
Thank you very much, Sola. What we have achieved so far have been something we could all be proud of. We have now a robust action plan for our office for the next 2 years. This plan ensures that our mitigation measures are culturally and contextually appropriate. We have made 3 commitments. Firstly, offering a safe working environment for all WHO personnel, irrespective of gender, position, and background. Secondly, cultivating a culture where colleagues feel safe to speak up and report, fostering an atmosphere where voices are heard, valued, and respected. Thirdly, declaring a zero tolerance policy for sexual exploitations, abuse, and harassment, and holding the preparators accountable. I now hand over back to Dr. Mark to close this segment. Thank you.
Thanks, Tema, Sala, and Nuha. In closing, let me just emphasise that this process has been valuable not just for our crucial focus on preventing sexual misconduct in WHO, it's also produced other benefits, like a request from some colleagues from the Fiji Ministry of Health and Medical Services for us to support a similar process for them. Like the recent Pacific Health Ministers meeting, where for the first time, it started with a clear statement on PRESIA. And also the safe and inclusive process that the team organised led to other issues being raised also, and those issues are also being addressed. So this, of course, isn't the end of our journey on preventing sexual misconduct, but together we've taken many important steps, and there are many more to come. It's an important journey for all of us. Vanaka Vakalevu.
We have been working towards improving our knowledge about PRESIA. So we have had quarterly meetings on PRESIA. We've worked on an action plan, worked on activities so that we create awareness and work towards zero tolerance for any violations of the organization's PRESIA policies.
When I first joined working in the office, I was informed that we have a number of resources on PRESIA. So I think it's really helpful and informative to know what your resources are in the event that you need them.
The other resources that we have online, we also have physical file here in the office where we can easily access the materials in regards to PRESIA.
The journey has been very encouraging, and as we continue to refine our programs and processes, we look forward to further strengthening the implementation of our organization's PRESIA policies and creating a safer environment for our staff and our stakeholders.
Thanks to our country offices And now to talk about an unusual initiative in the regional office, I hand over to Prishan. Over to you.
Thank you. I will tell you a story about our regional office. Last month, 21 colleagues united together with only one goal, envisioning WHO free from sexual misconduct. We use art to tackle this sensitive topic. In the foyer outside, you will see the passionate creations of our colleagues. Their energy was infectious, and also their determination and commitment to change really deeply moved me. Now let's hear from our three amazing colleagues who participated. Over to you, Bess.
Thank you, Pushan. Proudly, let me tell you about our masterpiece. The painting depicts Presea as a wrecking ball to break down the wall of existing norms and culture in WHO workplace. To break free and abolish these hindrances, Presea must eliminate this established culture that is deeply ingrained in our system. Presea, as an institution, must be a force with vast influence and power to demolish the wall by 2030. I confess our team was worried then because only one person can properly draw. We Googled photos to see how a wrecking ball smashing a wall looked like. We were very keen on how the painting will turn out, making sure it will clearly send the right message and visual impact for our cause. After the workshop, I'm even more committed to ensure that I will be conscious as an individual who is respectful, sensitive, and kind. Over to you, Robert and Riza.
Thank you, Bess. In our painting, we placed the 6 aspirational qualities of equality, inclusivity, openness, diversity, empowerment, and respect on banderitas because we want these to be celebrated and out in the open. I felt nervous at first because I don't really paint in my free time, but I quickly felt the inspiring and empowering environment that let our individual styles shine. The experience left me feeling that Presea can be fun and rewarding and wanting to create more spaces where we can all be seen, heard, and accepted. How about you, Reza?
Thank you, Robert. Our artwork symbolizes our shared desire to be seen, heard, and accepted. Yet sometimes we fail to extend due to differences of our speech, attire, color, religion, or categorizing G staff, P staff, consultants, or directors. Presea reminds us our voices within the organization and to treat each other as a unique individuals. I commit to Presea embracing differences and showing respect to our colleagues and recognizing our shared humanity. Back to you, Lakshmi.
Thank you, dearest colleagues, for showing us that prevention of sexual misconduct is all about small individual changes. So thank you. Dear Member State representatives, this is our commitment that we will do everything we possibly can to prevent sexual misconduct in this region, and that we will take responses, we will respond immediately and appropriately to any concern. WHO work environments include our joint work environments. As we move forward, we look to you, our government partners, for your unwavering support towards our endeavors. Thank you so much. Over to you, Susanna.
Thank you very much, Dakshini and colleagues. It is so great to see the commitment of colleagues across the region and the activities that are aimed at empowering individuals to speak out against misconduct. We now turn to the Office of the Regional Ombudsperson. Our Ombudsperson, Rodney McBride, and Associate Bess Bodegon have been working on raising awareness across our office on what psychological safety is. I now invite Bess and Yikong Lee to speak more about this topic. Over to you.
Thank you, Doctor.
Hello, everyone. I'm Bess Bodegon, Associate to the Ombudsperson here in the Regional Office, speaking on behalf of Mr. Rodney McBride. In 2023, the WIPRO Ombuds team, in collaboration with HR, has introduced a program of building psychological safety within our teams to support broader efforts to produce a healthy and respectful workplace. Introductory pilot sessions have been conducted in 2 country offices. So you may ask why we are focusing on psychological safety. Psychological safety nurtures an environment where people feel encouraged to share creative ideas without fear of personal judgment or stepping on toes. In this kind of environment, it feels safe to share feedback with others, including negative, upward feedback to leaders about where improvements or changes are needed. Research tells us that psychological safety in teams substantially contributes to teams' effectiveness, learning, employee retention, and most critically, better decisions and better performance. The Ombudsperson conducted a pilot program in China country office. We are going to hear now from one of our participants in that program. We have Yikong Lee sharing with us today. Please, Yikong, introduce yourself and tell us how this pilot program was conducted in the Beijing office. Over to you, Yikong.
Hello, everyone. Greetings from Beijing. I'm Yikong Li, Finance Associate from WHO Representative Office in China. During the visit by the Ombudsperson to the country office, we conducted a whole team meeting to discuss the subject of psychological safety. Prior to this meeting, the Ombudsperson distributed an anonymous survey to the whole team. This survey asked the team members about their views, including whether they felt safe to take risks and risk-making mistakes, whether the team is comfortable to raise issues and concerns, and whether team members are inclusive and helpful to each other. The team meeting discussed the definitions of what psychological safety is and strategies to enhance team members' sense of well-being.
Yikong, can you tell us more about this project?
The team discussed the data from the survey and began the process of developing an action plan to deal with issues identified in the survey. Our plan now is to create a small group led by WR Martin Taylor to plan further initiatives to address issues identified in the process. Over to you now, Bess. Thank you.
Thank you very much, Yikong, and we look forward to hearing more about the initiatives which will enhance psychological safety within the China office. The next step of this project will be a joint venture between the Ombuds Office and Human Resources. The focus in the next biennium will be to support team leaders with a focus on providing them with the skills to build psychological safety within their teams. By a wide margin, psychological safety has been identified as the key dynamic that sets successful teams apart from other teams. Our plan is to provide intensive training for team leaders so that they can enhance a sense of inclusion and well-being within their teams, thereby improving team performance. Thank you very much for your attention from the contribution of the Ombuds Office.
Thank you very much, Bess and Yikong. Psychological safety is important for many of our activities in our transformation agenda, and we are committed to supporting staff in creating psychological safe spaces where colleagues feel empowered. All these initiatives aim to create a workplace where staff well-being and organizational efficiency is strengthened, and people are supported to do high-quality work. In line with this, a range of initiatives aimed to strengthen our impact of WHO in the Western Pacific region are also underway. I now invite Arpit Agarwal, Acting Director of Administration and Finance, and Ying Rouleau, WHO Representative for Lao PDR, Martin Taylor, WHO Representative for China, and Amy Cawthorn, coordinator of strategic dialogue and innovation, to tell us more about this. Colleagues, the floor is yours.
Thank you, Acting RD. Over the last 2 years, Wipro has been actively engaging with staff to identify areas where the organization needed to improve its performance. Staff had raised concerns that the bureaucracy built up in internal processes was negatively impacting the performance of the organization. Through culture change discussions, feedback through town halls, and staff surveys, 3 processes were identified for simplification: recruitment of staff and consultants, program management, and publication of the organization's products. An external consultancy firm was hired to review and make recommendations for process redesigns with a very high level engagement for staff, around 30% at all the levels. At the same time, the WHO Director General established the Actions for Results group, comprising WHO representatives from all the 6 regions. A key ARG initiative has been the establishment of a core predictable country presence in all the WHO country offices. The CPCP includes the essential and predictably funded positions that every WHO country office should have to facilitate the impact. These positions are being included in the operational planning for 24-25, with recruitment slated to begin this year. Another ARG-led initiative is intended to strengthen the delegation of authority to WHO heads of country offices to empower them and make them agile. In May 2023, the Regional Office for the Western Pacific became the first to launch the initiative and issued the co-signed delegation of authority by Director General and Acting Regional Director to WHO heads of country offices. May I now ask Dr. Ying Ru, Head of WHO Country Office in Laos, to share her experiences.
Thank you, Arpit. Good afternoon, distinguished delegates, colleagues. Greetings from WHO and Lao PDR. The delegation of authority provides head of country offices with the decision-making power they need to be more agile and responsive to member state needs and priorities. This delegation covers recruitment of staff up to grade P5, procurement of goods and services up to $300,000, and most importantly, signing donor agreements using WHO standard agreements up to $2 million. Our office experienced very positive change resulting from the enhanced delegation of authority to WHO representatives, especially in the area of resource mobilization. Just to note that WHO and Lao PDR has only $1.6 million non-category 6 flexible funding for the biennium, which is not sufficient to cover our core country presence. Hence, the office relies heavily on resource mobilization. So we mobilized $1.8 million for improving the health equity for COVID-19 and routine immunizations in Laos, in Lao PDR. As a WHO representative, I have now the authority to sign the WHO standard donor agreement and mobilize resources swiftly. From the date of finalizing the proposal to the donor to signing off the donor agreement, it took 3 weeks only, and 15 days later, the funding was already in our work plan. As another example, we also recently mobilized $20 million bilaterally, 10 million each for WHO's work on integrated reproductive, maternal, newborn, and child adolescent health, and secondly, 10 million on improving health security. 3 levels of the organization coordinated extremely well to clarify and resolve issues during the review of the agreement because we did not use the WHO standard donor agreement and signed off. From the date of finalizing both proposals to the signing of the donor agreements, it took about 7 weeks. 14 days later, the funding was distributed to our budget center. For us, the delegation of authority and clear standard operating procedures go a long way to enable the work at the country offices and make processes efficient and effective. Thank you for your attention, and back to you, Arpit.
Good afternoon. I'm Martin Taylor, the WHO representative in China. The changes to the strategic and operational planning processes are designed to enable us from all levels of WHO to provide better targeted support to country priorities. In China, this is based on the country cooperation strategy for 2022 to 2026, which was agreed late last year. You can see on the slides the 2 broad strategic objectives and the 6 priority areas that were agreed in that country cooperation strategy. Based on that strategy with government, we had discussion to identify the priority areas for our assistance and cooperation in the program budget for 2024-2025. Building on that, a few weeks ago in September, we held a strategic dialogue in Beijing, led by the National Health Commission, supported by the World Health Organization, and including other government departments and other key counterparts in the health sector. At that strategic dialogue, we discussed the kinds of cooperation and technical support that would be required from all levels of WHO to support and implement the priorities and strategic objectives in the country cooperation strategy. Based on those discussions, 2 weeks ago, we from the WHO country office then had a dialogue with our regional office counterparts where we outlined the needs, the specific technical needs and the priority areas from which we in the country office would require assistance from the regional office and headquarters to enable us to better support China in the work that we do. This, of course, is an ongoing discussion and will continue. But the purpose of this, as I said at the start, is to enable us, based around our work with the government counterparts at the country level, to better align the support from all 3 levels of WHO behind national objectives. I now pass to my colleague, Amy Cawthorne.
Thanks, Martin. So given the extensive transformation activities that you've been hearing about in the last hour, the Acting Regional Director has established a WIPRO change management group comprised of directors, WRs, administrative and technical staff from both the regional and country office. The aim of this group is to coordinate all of these transformation-related activities across the organisation. To 1, ensure alignment. To 2, to hold to account the business owners that are accountable for the different activities. But it also has a really important role in ensuring that staff from across the region really feel part of the journey of change and are really kept up to date with the progress and relevant activities as they come forward. In addition, this group oversees a programme of change management aimed at ensuring we embed these mindset shifts that are going to be really important across our office to ensure that we drive and evolve the regional office so that we can ensure we are a safe, supported, diverse organisation that's both set up and operating to efficiently and effectively support all of you to deliver positive health impacts and achieve your desired health and wellbeing futures for your population. Acting RD, the floor is yours.
Thank you very much to all colleagues for sharing with us how we are working together to strengthen WHO's impact at the country level. Once again, many thanks to all the speakers and colleagues working on these very important initiatives aiming to transform the organization. With that, we would like to thank you all again for your participation in this side event. In closing, I want to emphasize that culture change is complex and it is time-sensitive process. However, our commitment remains. We are steadfast in our determination to implement initiatives and structures that will nurture and perpetuate these transformative changes. Our focus remains on creating an empowering and respectful workplace culture, which enables WHO to have an even greater impact on people and communities. And of course, member states, we are privileged to serve across the Western Pacific region. We hope you all have enjoyed this side event and look forward to more occasions where we share our journey to building a supportive organizational culture, ensuring a safer and more empowered work environment for all. And I'd like to thank member states for joining us, for shortening your lunch break. And this discussion will continue later today, also in the formal agenda of the regional committee. Thank you again, and thanks to the colleagues.
Good afternoon, respected colleagues. Welcome back. We now move to agenda item 10, panel discussion on charting the course, rethinking health financing for social well-being and sustainable development. Document WPR/RC74/4 revision.1. I would now like to hand over to Mr. Luis Vinals Torres, Acting Director, Health Systems and Services, to moderate the panel. Mr. Vinals Torres, over to you.
Thank you, Mr. Chair. Honorable delegates, good morning, good afternoon, good evening, Xiao Wu Jiao, and bonjour à tous. It's my honor to welcome all of you to discuss the agenda item of rethinking health financing in the Western Pacific region to achieve our goals for universal health coverage, overall social well-being and sustainable developments. First, I would like to give the floor to our Acting Regional Director, Dr. Susanne Jacob, to share her opening remarks. Over to you, Susanne.
Thank you very much, Luis, Mr. Chairperson, distinguished representatives. The Western Pacific has made great strides towards universal health coverage over the past 20 years. Now, essential health services are more widely available and accessible to populations in countries and areas throughout the region. Investment in health and related health financing reforms have played an essential role in expanding population coverage and entitlements, pooling resources for more effective delivery of health services, and creating institutions that strengthen governance and transparency in public spending for health. Still, persistent challenges remain. Government prioritization of health issues has been stagnating over the past decade. Passive purchasing practices have led to irrational escalation of healthcare costs. Essential public goods, such as public health functions and primary health care, are chronically underfunded. At the same time, in many countries in the region, a large part of the delivery of essential health services is left to market forces, which lack oversight, steering, and harmonization of the public system. These factors have increased disparities in health outcomes and exacerbated financial hardships for many. In the Western Pacific region, an estimated 376 million people, or about 1 in 5 people, incurred catastrophic health spending in 2019. That is among the highest in the world and absolutely unacceptable. COVID-19 has further derailed progress towards UHC for nearly 3 years, and its shadow still lingers. Countries and areas have emerged from the pandemic facing recession and weakened fiscal spaces, constraining their capacity to finance not only health, but overall social well-being and development. With less than 7 years remaining to fulfill the Sustainable Development Goals, member states must strive to augment and safeguard public financing for health. This can only be achieved by cultivating a shared vision across the society that embraces the value of investing in health for sustainable development. The May 2023 report from the WHO Council on the Economics of Health for All calls for renewed thinking to steer investment towards delivering what matters in national and global agendas. Distinguished representative and guests, we are here today to hear your views and insights on how to take these actions forward. In the face of a likely economic slowdown and emerging challenges such as NCDs, aging, climate change, and future pandemics, we must ask ourselves the hard questions. How do societies rethink health financing in relationship to the economy, social well-being, and sustainable development? How can we secure and intensify consensus around investing in health and UHC What actions are needed for countries and areas to spend money on health more equitably, efficiently, and strategically? Together, we can decide and do what works to ensure that the negative trends of financial protection is reversed and the region pursues a pandemic-proof and sustainable development trajectory. Over to you, Luis.
Thank you very much, Susanna. Thank you very much for your excellent points. Before we start and I share the objectives of the session, I would like to put a video, to share a video with all of you where we can hear and to have a bit of human touch of what are the challenges on health financing in the region. So please, can we put the video on? Thank you. The last 2 decades for the, let's say, larger Asian Pacific region, there is very good news. There is a substantial progress on service coverage.
We have adopted a primary healthcare approach, the basic to reform of the system.
围绕这一目标，中国政府不断完善卫生筹资政策，加大公共卫生筹资投入的力度。Tôi nghĩ rằng là với Việt Nam chúng tôi hiện nay thì khá là tự hào ở trong cái việc mà thực hiện cái chính sách bảo hiểm y tế. Chúng tôi thực hiện chính sách bảo hiểm y tế từ năm 1992 đến nay thì đã được 30 năm. Nhưng đến hiện nay thì chúng tôi cũng khá là tự hào. Hiện nay hầu hết dân số Việt Nam thì đã có bảo hiểm y tế, không phải là toàn bộ. Nhưng đến nay thì chúng tôi đã bao phủ được 92% dân số. The reform of Mongolia's health financing system was focused mainly on output-oriented models. One of Palau's biggest healthcare financing progress is the passage of our National Healthcare Financing Act.
We are observing that we are not going into the right direction is on catastrophic health expenditure.
We have still challenges that needs to be addressed. For instance, out-of-pocket expenditure is still high, especially in outpatient services. And secondly, the medicine price tend to increase year by year. 在当前的形势下，中国卫生筹资当然也面临着一些新的挑战，比如经济下行压力增加，人口老龄化加剧，城镇化进程加快，疾病谱的变化等等。
สามารถบรรลุการควบคุมถึง 94 ส่วนห้อยของประชากรทั่วประเทศกองทุนดังกล่าวงบประมาณจากรัฐบาลและการเก็บเงินสมทบจากสมาชิกและประชาชนเล็กน้อยเพื่อประกอบส่วนเข้ากองทุนในเวลาไปใช้บริการแต่ยกเว้นเงินสมทบจากไม่มีลูกค้าเด็กรวม5 ปีและผู้ถึงงาน
I guess the first important challenge which I'd like to put across is population growth. Financing health services in Papua New Guinea is a challenge.
So many reforms have been initiated and now are being taken forward. But what is critical is that these reforms not only focus on just gaining efficiency, but they do focus on equity.
EHC or health financing, of course, we need to have good technical issues. We need to strengthen this technical capacity, but the major breakthrough is almost always coming from the political will.
The agenda of the big change is domestic. Most of the solutions that we would like to see has to be funded domestically.
Ang unang dapat nating gawin is for governments and our countries should prioritize health in their national budgeting and allocate a significant portion of their budget for healthcare.
That countries should spend more money for health. A lot of countries in Asia and the Pacific work with private health sector delivery. So they need to resolve that, whether the private health sector will be part of their approach in actually pursuing UHC, or they will basically disregard that. I think there's been a lot of progress. It has become a target that countries all aspire for.
Thank you, colleagues. Let me put into a couple of slides what has been in almost all the speeches that we have heard until today, from Monday. We have done a good job, and there is good news on service delivery. And if you look at the green line, where is the Western Pacific region progress towards UHC, moving to the right side is the right direction, and we have done collectively a great job. But we have not done a good job at all on the financial hardship part. We are going downwards. We should be at the top right quadrant, and we are at the bottom right. As our acting RD was sharing, next slide, the reasons that are driving this performance have to be looked at the purchasing part, on the way how we are paying providers. But also, and a reflection that I would like to invite everyone here is how the region has been prioritizing on health. Again, collectively, this line, almost flat, shows that the share of government spending on health out of government spending has been around 10% on average on all countries in the region. As a comparison, OECD countries spend 15.4%. Obviously, the region is very diverse, and actually the composition of the panel that we are proposing today reflects that. The Pacific has different challenges compared with Southeast Asia or the high-income countries. But what we all share is the challenge of the future. Aging, non-communicable disease, and a different pattern of demand from our population means that we will require a larger health sector. We need to think about efficient solutions and about sustainable solutions. This requires that our models have to be more efficient and more equitable. Next slide, please. For this panel, next slide. We are proposing 4 objectives. The first is to acknowledge the progress that has happened in the region. The second is collectively look at the challenges, current challenges and future challenges. And finally, to bring the health financing discussion as part of the global social well-being and sustainable development of our countries. What is the role of health financing in the overall development of countries? As part of this narrative, primary healthcare and strengthening primary healthcare will play a very important role. And for this reason, our guest speaker for today, which will help setting the panel, we have invited Professor Kara Hansson. She is the Dean of the Faculty of Public Health and Policy at the London School of Hygiene and Tropical Medicine. And I want to thank Kara for waking up very early in London to join us and to share your experience. Just want to highlight that Kara has been leading the Lancet Commission's work on primary healthcare financing. Kara, can you hear us well?
I can hear you very well. How is my sound?
Perfect. Over to you, Kara. Thank you.
Great. Thank you very much, Luis. Honorable ministers, distinguished representatives, distinguished chairperson, acting regional director, ladies and gentlemen, it's an enormous privilege to join you today to speak about rethinking health financing for UHC and healthier societies. Next slide, please. The critical role of primary healthcare. Next slide. Can you click? So as you've already heard from your acting regional director and from Luis, There has been enormous progress in service coverage in Wipro in the region over recent years. Your service coverage index increased by 30 points to 79 in 2019. And to recognize that coverage has faltered in all parts of the world because of the interruptions in services due to COVID. But much more worrying is this deterioration in financial risk protection. Out-of-pocket spending is a major concern. Catastrophic spending and impoverishment due to health spending have both seen the steepest increase in the Western Pacific region, as you can see from the increasing red and purple lines in the Western Pacific bar on the right-hand side of the figure. Wipro is a very diverse region. Sorry, back please. But looking at the composition of these out-of-pocket payments from a variety of countries in the region provides some clear indications of where the problems lie, both with spending on medicines and outpatient care making up around 80% of out-of-pocket spending in a variety of countries in the region. Placing primary health care at the center of health financing reforms is likely to be the most efficient and equitable approach to health system development. Different countries will do this in different ways, but there are some common principles that I'd like to highlight for you this afternoon for you. Next slide, please. Next slide, please. So I'm going to be drawing from the work that we did in the Lancet Global Health Commission on financing primary healthcare that was published in April 22. So some of you may have heard this before. This was the work of global experts from national governments, from academia, and from the global health agencies. And there was one main message that governments need to spend more and spend better on primary health care. And by spending better, I mean putting people at the center of health financing arrangements. Next slide, please. This is my favorite figure from the Commission. I think it tells the whole story. It shows that, that higher government spending on primary health care is strongly associated with higher coverage. That I think we all understand. I think really importantly, it also shows that countries are able to achieve varying things with their spending. And so if you were to draw a vertical line, say at $50 per capita, you would see that countries across the world have managed to achieve with that spending anything from 50 to 80 on the UHC coverage score. So this means that whenever you see variation in coverage, you think, countries are actually spending their money differently. And some countries are getting better results for the expenditure that they're incurring. And more than just the levels and the increased spending, I think we really emphasized in the Commission, pardon me, the importance of using spending on primary healthcare to drive changes in the health system that will encourage the use of primary healthcare and the consequent protection of individuals from high levels of out-of-pocket payments. Next slide, please. So I don't need to tell this audience about the importance of primary healthcare. I think it's really evident that expanding access to frontline providers through increased public funding is the most efficient and equitable way of improving health outcomes. But more than that, in a region with such diversity, primary healthcare provides a platform for improving population health and for managing the evolving burden of disease. There's also a strong equity element to this. Primary healthcare services are more pro-poor than hospital care. Next slide, please. So this was the framing of our commission. So we identified three key problems: that there's insufficient funding for primary health care, that funding is often captured by hospitals, and that the use of these funds is challenged because funding is fragmented, inflexible, and inefficient. And so from that came our three recommendations: spend more, allocate equitably, make sure that allocations reach the primary healthcare level, and then align funding flows and incentives. Next slide, please. Where does the money come from? It has to come from increased government spending This is recognizing that health spending is an investment in human capital and an investment in economic well-being. It's not a burden, and that it's the responsibility of society as a whole. Government spending across the world is variable, but very, very low in low and lower middle income settings. And even in upper middle income settings, that spending on primary healthcare is not sufficient to fund a comprehensive package of PHC services. Next slide, please. Funding is also highly fragmented, and this is a consequence of low levels of government spending and high out-of-pocket payments. In the very lowest income countries, it's also contributed to by a large share of external spending. But we also see is that patients are paying for drugs, donors, where they're important, are paying for prevention, and governments are spending on outpatient care. And as countries grow richer, as you can see in the high income quadrant in the lower right, government pooled resources tend to play a larger role, offering opportunities to reduce the effects of fragmentation. Next slide, please. So how do we spend more? The key is to allocate more resources to primary health care. This means ensuring that there's a clear responsibility for primary health care within the Ministry of Health, prioritizing PHC within government budget processes, and then using that funding to ensure accessibility and quality of primary care services that are free at the point of service use to make them more attractive than paying out of pocket from other providers. Essentially, for this region, it's important that medicines are included in the service package, but together with a variety of other policy levers to ensure the efficiency of the drug system. Next slide, please. We also need to spend better on primary health care. My previous speakers have highlighted the importance of purchasing strategically. This means, in the first instance, having a budget line for primary health care, if this doesn't exist already, of using a population-based criterion for allocating resources to achieve equity, allocating budgets, defining spending rules, and giving local governments and local departments the autonomy to spend well. And finally, as management capacity permits, develop a more sophisticated provider payment system that places capitation at the center, but uses other policy levers to achieve health goals. Next slide, please. My time is short, so allow me to summarize my key messages. The first is that really people-centered primary health care has become a mantra, but we should also be placing people at the center of our health financing arrangements. This means that public resources should form the core of primary health care funding, that pooled funds, whether this is from taxes or from compulsory insurance, should cover primary health care first and include essential medicines, that resources should be allocated equitably and protected until they reach frontline providers, and that provider payments should develop towards a blended system with capitation at the core. Next and final slide, please. If I could leave you with this final image in mind, that investing in primary health care is an investment for social development and for healthier societies, that it leads to improved equity, to improved health system efficiency, to improved health outcomes, and these three together will help to achieve important economic benefits, including improved workforce participation, of the health and productivity of the population, and reduce the impoverishment associated with health. So I wish you all interesting deliberations, and I'm looking forward to hearing the next speakers. Thank you very much.
Thank you very much, Cara. It has been a fantastic way to bring us the global evidence on why primary healthcare financing merits all our attention. And I will take three key words: government spending on medicines and revisit how we are paying the providers. Thank you very much, Cara, to set the scene and bring us these excellent points. Now, I would like to turn to our honorable representatives and speakers, and I would like first to thank you for participating in this in this panel. So we have the privilege to have the Honorable Minister Gafar Uher Balau, Minister of Health and Human Services of Palau. Thank you. Then we have Datuk Dr. Nurhayati Binti Rusli, the Deputy Director General of Health, Public Health, Ministry of Health, Malaysia. And then we also bring not only health views, also finance views. And for that, we have invited the Undersecretary Catherine Fong, which is the Undersecretary for Privatization and Corporate Affairs Group at the Department of Finance of the Philippines. Thank you again for joining us. So we have talked about diversity. So let's bring all the diversity to the floor. Let's start by a small island state, Palau. Out of pocket is not big in Palau, but that doesn't mean that you are free of challenges. Procurement, purchasing power of the procurement, perhaps unmet needs, overseas treatment, expenditures. There is many challenges. Can you please, Honorable Minister, can you share insight on what have been the priorities in financing decisions in the health sector in Palau? The floor is yours.
Thank you, Luis, and good afternoon, everybody. Chair, Vice Chair, Acting RD. My feet are still sore from dancing last night, and it's a bit hard for me to get up this morning. Good afternoon, ladies and gentlemen. Yes, very, very good question, particularly for smaller island developing states like Palau. You know, our population right now is just under 20,000. And you can imagine we have priorities and challenges on both the government side as well as the community side in terms of affordability and accessibility of the public to access basic and essential medical and primary care needs. On the government side, it's always about how do we sustain service delivery. And Luis, you mentioned procurement, and that's just one of the many challenges that we face. And I'm really happy that we have a guest speaker from the Department of Finance from the Philippines, because this is that intersectoral multi-stakeholder initiatives that we need to take in order to look at health financing as an issue. So for Palau, a little under 20 years ago, around 2006, there was a leadership meeting where they prioritized finding a way for us to address all of these issues, particularly around affordable healthcare coverage. So following that, there was an ad hoc committee that was created, which led to, as you saw in the video, the Palau National Healthcare Financing Act. And so that was established in 2011. So that social health insurance scheme was based on the Singapore, which was determined to be perhaps the best for a small island setting of Palau. And so since 2011, we've had the National Healthcare Fund, which looks at financing ambulatory outpatient care, as well as inpatient and off-island referrals. Now, the challenges we have with that is that now there's access, but how do we increase the value of that return of investment? How do we ensure that the appropriation and the money that we're getting equates to better standards of and delivery of care? And so looking forward, I think, as you mentioned, Luis, about aging populations, we're seeing higher mortality, NCD mortality and morbidity among younger people. And then you couple that with outmigration, and then you have a negative number across the board. So that's really looking at 10 years down the road from establishing this healthcare fund. What are the lessons that we've learned from that, and how do we improve on it in anticipation of trends that are to come? That's basically it. And of course, with COVID, we saw a little bit of increase in that government expenditure on health. but that doesn't mean it's gonna remain at that amount. So that's really where the challenge is looking at the mortality and morbidity trends and health population trends moving forward, and how do we adapt our health financing mechanisms to address that?
Fantastic answer. And I think that most of the policy relevant questions that you have raised will be shared for many of our colleagues. And I particularly like this point of how to better collaborate with the finance sector, and the fact that your scheme already includes ambulatory care, where, as Cara was presenting, is where many of the problems of financial hardship happens. Fantastic. Thank you very much. Now let's turn into another complete different setting, Malaysia. I would like to hear from Datuk Nur Hayati. Malaysia is a very well-performing system when the fundamentals are being analyzed. On financial hardship, has done a remarkable job, actually among the best performing in the Western Pacific region. So what policy measures are in place to ensure that this is happening? Over to you.
Yep. A very good afternoon, noble ministers, head of delegations, ladies and gentlemen. First of all, I think I would like to thank WHO for actually offering Malaysia as one of the panelists for this session. And this topic is very interesting, and I think I do understand that Malaysia is one of the Western Pacific countries that do have many challenges in public emergencies in terms of chronic diseases as well as infectious disease, even disasters. But then I would like to bring everyone here before COVID-19 pandemic in 2019, where Malaysia was ranked under 66 out of 141 countries that have been evaluated in the health category of the World Economic Forum Global Competitive Index 2019. And that, during that time, in that evaluation, we were evaluated based on the health infrastructure, basic indicators, preventive care, and business impact diseases. And we do understand that even though we had achieved universal health coverage from 1980s, but then we do understand we had achieved a very minimal incremental achievement or development. And Malaysia has achieved on the accessible, equitable, and also affordable healthcare to the majority of the population. However, there's still rooms for improvement that we need to improve from time to time. Because we do understand that, for example, right now, Malaysia, we have a dual healthcare delivery system comprising of subsidized public sector as well as the profit private sector. And most of the population utilize the public sector, about more than 70%. And most of the private sectors, like private clinics, private hospitals that are located at the urban areas, where people, they are providing services to those who are with private insurance, the employee health benefits, and also out of pocket. And if you're looking into the network that we have, Ministry of Health, or the public healthcare facilities that we have currently, we have about 3,000 plus health clinics, actually, altogether about 3,059 public clinics all over Malaysia, as well as 11,472 private clinics, including GPs and dental health services all over Malaysia. But then in looking into the accessibility, we need to understand that equity to access to healthcare is very, very important to every individual population in the country. So most of the populations lives within 5 kilometer radius from the static health clinics, whereas others at the remote areas. And then these the things that we need to look into is on the mobilization or mobile clinics, or how we want to approach the populations at remote areas, because most of the private clinics are located at urban areas. And we have actually services, mobile health teams through land, air, as well as through water. However, we really admitted that the current situation where now increased burden of non-communicable diseases, the communicable diseases with malnutrition issues, mental health issues, we have aging population nearly in 2030, and also talking about the financial health financing for the healthcare deliveries on the environmental, public health, and so on. So there is really a challenge to the health deliveries in the midst of Malaysia. But then during pandemic, COVID-19 pandemic, we noticed that the gaps, we can see large gaps where there's a very extremely evident the challenge that we faced at the time on the financial strain as well as on the resources of that. So, but then because of the whole government approach, we have implemented the whole of government approach, and then we have expanded the scope of from whole government approach together with the whole society approach. And now we're talking about the whole policy health in all policies. This is a very important point that we'd like to highlight, that with this, the whole government approach, the whole society approach as well, this on the health in all policies really help Ministry of Malaysia in managing COVID-19 pandemic. And we want to expand this scope to other continuous collaborations on this mechanism where we enhance the preparedness and response. And in 2021, actually Malaysia has launched the Healthy Malaysia National Agenda, in which this agenda is a cross-stakeholder platform in which we have set up this platform to have various ministries, agencies, institutions, civil society organization with the objective of to cultivate a healthy lifestyle and promoting environmental sustainability to support the health and well-being of the population. I think we would like to continue on the importance of the importance of whole of government, whole of society, and health policy approach in our healthcare deliveries. Thank you.
Thank you. Thank you very much, Dr. Datuk Nurhayati. It's important that even the good performance of the sector, you're still keeping trying to address the challenges of accessibility and particularly learn from the COVID-19 response and what can be adapted for the system. Now, I would like to turn to finance. Professor Kara was requesting more government spending, and of course from the USEC, from the Department of Finance of the Philippines, your worries from where this money will come from. But not only focusing on public sector, but on the overall resources for the health sector. What will be your thoughts on how to mobilize resources in the context of the Philippines? Thank you.
Thank you. First of all, thank you for inviting me here. I'm glad to be here. Yeah. Yes. First of all, so I see the topic is about rethinking health financing. I think I agree with everybody and with Professor Kara that we need to provide more financing to public health. However, in our experience, financing is not enough. In terms of funding, the funding source, it's never enough. We need more money. And when I say not enough, it's not enough in two contexts. Okay, first of all, the money itself. The money is never enough to fund everything we want to fund. That's one. Second, even in the situations where we have enough money or we've put enough money in a situation, sometimes financing is not the sole problem. Okay, in the Philippines, we've already had a lot of successes. We've had a lot of improvements on universal healthcare. We have sin tax reform and additional sin tax laws, which provide revenues from alcohol and tobacco into the universal healthcare. Now there are proposals to have salt tax, junk food tax, other kinds of sugar tax to put back into the universal healthcare. And then we have the
we have the casino, the operations, putting 50% of the revenues into the universal healthcare. So the universal healthcare is being funded. There's that. The recognition of the importance of the universal healthcare is already there, and we're trying to find more ways to continue to fund it. But then you go down the line, PhilHealth, the health insurance is our primary means to deploy this universal healthcare. And then if you've read the news lately, they've been hacked. So we have that situation where PhilHealth itself, how to prevent fraudulent claims, how to speed up the disbursement to repay the claims from PhilHealth, that's another problem. And then you go down, we have situations where hospitals are properly funded, but then there's a problem in procurement. There's a problem in delivery of services. There's a problem in retention of talent. A lot of Filipino health professionals go abroad. So how do we keep them here? So when I say financing is not enough, financing as money is not enough, it's never enough. And financing as a problem is not the only problem. So in the Philippines right now, we're looking, we're thinking out of the box, trying to find ways to have alternative solutions to the problems. Right now, we early on in this administration, we approved the PPP Cancer Center, PGH Cancer Center through a public-private partnership mode. Our transaction advisor is IFC. Health PPPs are very challenging. This is a pilot one, so it's still to be launched. The tender is soon to be launched, and hopefully will be successful. We also just last week approved a renal care PPP in the Baguio General Hospital. So hopefully, if this is successful, it could be replicated in other parts of the country. And in terms of financing, it's an availability. Well, for the cancer center, it's availability payment based. Actually, the funding is coming from government, but we want to see the efficiency of the private sector in deploying the services to the public. So we're thinking of these kinds of scheme where it will be not the cost to the public will be the same as provided by the universal healthcare or as provided by PhilHealth insurance, but to how to upgrade the services so that it's deployed more efficiently and talent is retained. In other projects, for example, I'm in discussion with the Secretary of Health, Secretary Herbosa, to look at providing housing for DOH, for the Department of Health workers. I mean, in a way, as a way to retain talent. And this housing will not be, the ownership will not be transferred to them. For as long as you work for the government, you have nice housing, something like that. I mean, we're trying to think out of the box because, as I mentioned, money itself, financing itself, it's not the sole problem. So that's all. Thank you.
Thank you, Yusek Fong. Very interesting in how this dynamism of the Philippines on raising revenues with different ways, but also on spending it, and trying to tackle these bottlenecks by thinking outside the box. And I think that perhaps many of the participants will want to know more after your intervention. Let's go back to Palau. And I think you have raised very relevant issues. As I said, they are the policy relevant questions to, I would say, most of us. So what are the plans of Palau a bit looking forward? What are the policy changes that you are considering for the few coming years? Thanks, sir.
Thank you. Yeah, I think the priorities are to make sure that our data systems are intact, to provide us better data for decision making. But in terms of health financing, I think the biggest goal for us is to stop punishing bad behavior, to start looking at incentivizing and rewarding good behavior. Like Undersecretary mentioned, sin taxes. We focus a lot on sin taxes and punishing bad behavior, but we don't look at similar incentives for companies or agencies that solely look at health as a product. And we've spent a lot of money over the years on NCD diagnostics and treatment, but not so much on actual healthier alternative products to tobacco and vapes. And so, you know, things to think about. The other thing is we need to start shifting our focus in the healthcare setting from hospitals and treatment to focus more on primary care and prevention. And a lot of times we come to these forums and we talk about prevention, primary care preparedness, but the money, the plans don't always align with what we say. And we end up losing more on trying to fix healthcare infrastructure in terms of actual hospitals. Our hospitals in the islands are falling apart. Yes, it is a priority, but we need to realize that if we prevent people from needing the hospital, then you're going to relieve that burden on hospitals. So I think it's time that we put our words into practice and really look at ways on delivering primary care in a balanced approach and resource allocation. Yes, we fix our hospitals, we try to improve our standards, but at the same time, really looking at investing in primary care, decentralizing services, reaching underreached populations. I think that's the answer. Thank you.
Thank you very much, Honorable Minister. I think that this description of the shift to and how money more for health promotion, a bit walking the talk, no? And I think you and in willing to invest on answering these questions and to set the systems are really on the right direction. Thank you very much. Now, again, we'd like to talk to bring it to Malaysia. Malaysia during 2022 invested a lot on the health white paper, a very high level document that has helped put the different stakeholders together in the interest of the system to define and set the frame of the system of the future for Malaysia. So Datuk, could you please elaborate a bit more about this experience? Thank you.
Yeah, it's really blessed to us because recently the health paper has been approved or stable in Parliament has been approved. So this is very important to the Ministry of Health Malaysia because we do understand that improving our health system and population's health in a minor incremental improvements, we no longer be able to address the current challenges, especially during a pandemic, any public emergencies. So Ministry of Malaysia has developed these health white papers based on the gaps that we have been evaluated the experience through when we faced the COVID-19 pandemic. And we do understand with the current challenge that we face, especially on increased burden of communicable diseases, non-communicable diseases, issues of malnutrition, mental health, the aging population, and so many things, especially and including the public emergencies. And we need to reform. That means the Ministry of Health Malaysia need to reform the healthcare delivery. For the past 30 years, we have been doing with minimal incremental improvement to our healthcare system. But then once the approval, because this health white paper is a very comprehensive framework in which it will focus with 4 main pillars. I just list down the pillars. One is transforming healthcare service delivery, advancing health promotion and disease prevention, ensuring sustainable and equitable health financing, and the 4th one is strengthening the health system foundation and governance. And if you look into that, the main objective is to have a system with broad solutions towards a high quality, equitable, sustainable, and resilient health system. If you look into the broad centers here, talking about higher quality, equitable, sustainable, and resilient health system is not easy. How we want to achieve this white paper. That's why we have been given 15 years for us to implement this health white paper, and we're going to review from time to time. And under this health white paper, there are a few things that we need to enhance, or we will be prioritized under the health white paper. One is talking about the transforming healthcare delivery. Last time we focused on curative. That means now, maybe currently, we are focusing on curative and treatment care, but now we need to look into the importance of promotive, preventive. That means on healthcare as well as wellness care. So this is one important thing that we want to enhance on that part. Looking at that, when you look, if you want to enhance the primary care, and as well as how you want to empower the community at community level, this is very important. We need a whole government approach, the whole society approach, help in all policies. We need to improve, enhance our capacity, capability, even the resources, the financing, all that. So even this, the competency of the staff, the skill. That. So that's very important. That is one thing that we would like to optimize or to increase, enhance the capacity capability at our primary healthcare level. And talking about the promoting and prevention, I think this the one that the another points that we want to enhance the promotion of this prevention. This is very important. That's why during our World WHA meeting, the resolutions been approved under the behavioral science, where Malaysia presented, brought up the behavioral science on that time. Then, but then looking at the importance of reform here, evolving from curative care to preventive, promotive healthcare and wellness care, we need a sustainable and also equitable and progressive financing system. This is very important because if you don't have any sustainable financing mechanism, I don't think we can achieve even after 15 years. This is very important. That's why the government really committed in providing the financial commitment to the Ministry of Malaysia for us to implement this health white paper. So there are more things to share actually.
Thank you very much, Datuk Nur Hayati. I think that building on the Honorable Minister of Palau, there is really a will to have health financing that funds systems that keeps people healthy. And actually this is beautiful words, but we need to collectively work to find the how. And I think that we really need to facilitate this collective learning and knowing the how to do it across countries. So let me turn once again on Ministry of Finance, Department of Finance of the Philippines. The Philippines, like other countries in the region, have a large private sector in the delivery side. It's not the reality in all countries of the region, but in some countries is a reality. And in this context, private sector has to be part of the solution. So can you share some thoughts on how to?
Yes, so right now, as I mentioned, we're struggling with a lot of issues, not just financing. So we actually have examples of hospitals, brand new hospitals with brand new equipment, and the equipment are not well maintained because they cannot procure parts soon enough because the hospital administration is not, not in the level of a private hospital. So it takes another 6 months just to procure new band-aids. So it's again, the financing, it's not the only issue, and there's a recognition that private sector can be more efficient if incentivized properly. And as long as it's not disadvantageous to government, it's just a fair transaction, they're able to get reasonable returns for their service. So we are working in partnership with the private sector In fact, social PPPs, when we say social, healthcare, as well as education, these are relatively new kinds of PPPs, and it's still very much in development. And we're working with multilaterals like the ADB and the IFC to help develop these sectors. There are health services that are easily, shall we say, PPP-able. There are health services that are not suitable for PPPs. So where it's not suitable for private sector, we keep them to the private sector, where it's something that the private sector can do. For example, the hemodialysis, that's a fixed cost. So that's something that we can, in theory, farm out to the private sector and get an easy kind of computation for their returns, right? For general services, that's a more complicated one that's kept to clinical services or kept to the public sector. So there's that recognition that the private sector is there. There's plenty of private sector willing to come in. We welcome them. And as long as the deal is fair to the government, we think of it as a way of extending quickly the services and the efficiency to the rest of the country. I mean, a lot of the tertiary hospitals are concentrated in Manila. We want to expand to the provinces and to the remote areas. So, I mean, market is an issue for private sector, of course. Where there is no market, government has to step in, or it's through availability payment. Doesn't matter what the demand is, government will pay you for operating a hospital or a healthcare service facility. So these are things that we are exploring, definitely, because it's a way to make things more efficient. We're also looking at a potential public-private partnership for the PhilHealth backbone. Because as I mentioned, even though the funds are there, the leakages in the insurance system, duplicate claims, fraudulent claims, speed of disbursement of the claims, payment of the claims. So this is another problem. So we're looking at a solution, a partnership with the private sector on the IT backend solution, also on that kind of. So in the areas where we can take advantage of the efficiency of the private sector, we're definitely open to that.
Thank you very much, Yusheng Fong. I found very healthy this questioning about the PPP ability of, particularly with having a universal health coverage lens, and see, are these PPPs going to help pursuing the public policy goals, right? And I think that making it explicit and analyzing, I found a very good experience to share. So thank you again, the three distinguished panelists. So the second and last part of the panel is we are inviting two reactors, which is going to share also their views on what have been shared and also additional points. So first of all, I would like to invite Dr. Ramesh Subramaniam. He is the Director General and Chief of Sector Groups of Asia and the Pacific at the Asian Development Bank. And right now, the ADB has recently produced the Strategy 2030 of Health Sector Directional Guide. So ADB is back with force and a lot of is prioritizing health. And it's a very important actor, particularly in our region. So my question to you, Ramesh, is how does ADB see investing in health impact social well-being and sustainable development in the region? Thank you very much for joining us.
Great. Thank you so much, Luis, first of all, for inviting ADB as well as to acting RD, Dr. Jacob. This is also a historic milestone period for the WHO regional office. So heartiest congratulations to the regional director elect and nice to join this event today. The topics that we are discussing and the fantastic insights that we got from the three distinguished panelists These are super important for ADB as well as a multilateral development bank. As both you and Professor Hansen pointed out, there is significant variability or variation in healthcare spending. Now, this is interesting variability across developed countries, not just amongst developing countries, but across developed countries as well. With regard to total healthcare spending, as well as if you look at particularly government healthcare spending. But at the same time, I'm very happy that the Honorable Minister of Palau, Minister of Health of Palau spoke. That's a country that stands out in terms of at the top in terms both per capita spending as well as a share of GDP, but many others are lagging behind and there are challenges that we face. But regardless of the levels of spending, you do have significant access issues. So echoing what Kathy mentioned, clearly it's not just financing, you need wholesale reforms. And at the ADB, we are looking at health reforms along with finance, as well as reforms that need to take place in many other sectors. Including, for example, urban, and if we are broadening it to look at climate as a theme, there are many intersecting elements where health comes in. A recent study that we had done with particular focus on Southeast Asia showed that increasing healthcare spending from the current average of about 3% of GDP to about 4.5%. So 1.5% increase in spending will result in an uptick of at least an equal amount in real GDP. So meaning 1% increase will certainly produce at least 1% increase in real GDP. So there is evidence that there is clear relationship between health spending through direct as well as indirect linkages to overall economic growth. Now, this is a conservative estimate, and there is considerable upside risk. Now, as an outcome of increased financing, achieving universal health care as well as overall improved health indicators has obviously been a top priority for most developing countries, but as we know, they are in different stages. And if we, as a measure of UHC success, we can look at the UHC coverage index, and within the Asia and Pacific, even the high spending countries are actually showing UHC coverage indices scores of less than 50. While developed countries are showing scores of above 80. So here, then we get into issues of spending efficiency and what needs to happen in the health sector as well as in the other sectors. So in order for the region to move ahead on all these fronts, there is very clear need for policy reforms, bringing particularly health and public finance reforms together, but many other sectors into play. And as I mentioned at the beginning, climate is one such area which is cross-cutting and which with significant implications for health. And I'm happy that Kathy spoke, and Philippines obviously is a very good example where the Department of Finance has worked very collaboratively with the Department of Health and the other actors in promoting USC reforms. And then we do have many examples in the region of such situations. Now, looking at broader financing dimensions, let me give one data point. If you look at all global assets, these are broadly defined. If we monetize them, the figure is actually quite staggering. It's $1,500 trillion globally, according to a recent study. Now, in this context, if you look at Sustainable Development Goal investment requirements, the world needs just around $4.5 trillion. So 4.5 trillion to $1,500 trillion. This is to meet SDGs by 2030. But as various studies, including various UN agency studies have shown, with the current levels of spending on SDGs, the world will not meet the SDGs even by 2060. So what are we doing here, and what can ADB as a multilateral institution can do in this context? Now, within the $4.5 trillion, developing Asia, our estimate shows, needs about $1.8 trillion or so. And within this, if you look at health and broader health sector related, climate related SDGs, we may conservatively estimate that about half of this will be the total needs, total unmet needs as of now. So the challenge for us is, in a world with lots of money, how do we mobilize the resources that are needed for healthcare financing and what is needed by way of health reforms? And I think here I echo some of the points that Kathy highlighted. Now, at the ADB, or recent institutional reforms leading to what we call as a new operating model, are focused on bringing considerable resources to our developing member countries. Now, we prioritized what we call as 4 shifts. The first is climate change shift, which is very, very critical for Asia and the Pacific, particularly for Pacific Island countries. This is a major existential issue that we need to look at. Second is private sector development shift. Now, all these resource requirements that we are talking about cannot be met with the public sector acting alone and with institutions like ADB acting alone. You need significant private sector money coming in, but then there are considerable risks. And what role do we play as a multilateral institution in de-risking those investments to bring in, whether it's into PPP-able areas or other areas where private investments are needed? And the third is solutions shift. The new problems that the health sector and the other sectors are broadly facing need new solutions, not old solutions. So what is it that we can do? Particularly, for example, digitization. WHO has worked closely with the G20 presidency this year of India in launching the Digital Health Initiative. What can we do in strengthening new solutions? And then finally, new ways of working, by which we mean stronger partnerships that are needed, because it's not just one player acting alone, but we need partnerships. Now, for health alone, we aim to, from our institutional point of view, we aim to achieve a total healthcare financing volume of at least 10% of our total lending, which is around $25 billion. It's significant, but definitely not enough given the scale of the challenge that we face. In this context, just 2 weeks back, ADB became the first multilateral institution with our shareholders approving the G20 Capital Adequacy Framework update, which will give us an additional $10 billion. So that's about $36 billion of annual lending. Now, if you put a 10% to that, nice, but not enough. We need more resources. So what is needed? So here is where we need stronger partnerships on which we are focusing heavily as part of the 4th shift. I mentioned the new ways of working or the partnership shift. Now, linking this to the climate challenge, one such example is the Climate and Health Initiative, which ADB has designed working closely with the Indian G20 presidency. The Climate and Health Initiative will help formulate innovative financing arrangements to boost climate-related health spending. Now, for climate, we aim to achieve a cumulative volume of $100 billion by 2030. Now, health and climate related assistance will also go up as part of this financing package, but we need to mobilize considerably more resources. And finally, an important point to note is that the boost that is required in health spending will not happen unless there is greater private sector engagement in health and climate-related investments, which will have significant positive externalities on health, which will positively impact on health. And in this context, we look forward to working very closely with WHO and the wider ecosystem, and as well as to with all the WHO and the ADB member countries in meeting these challenges. Thank you again for this opportunity.
Thank you very much, Ramesh. A lot of good news and very deep and provocative and interesting analysis. No, there is enough money around there, but definitely is not being mobilized at the scale needed. But the scale needed is not that big when put in relative terms. And also good news about this explicit link that ADB is doing on climate change and health. And also like that the complementarity with USEC Fund, no, it's more resources are needed, but also agreeing that looking at the ways how the resources are spent, it's equally important and part of the discussion. So the last reactor and speaker of the session, I would like to benefit that we wake you up, Kara, in London, and if you could have your few reflections about what the contributions of the speaker. Thank you again, Kara. Over to you.
Thank you so much. So those of you who are very observant will see that since we've been speaking, it's got light outside. So we are now fully in morning rather than very, very early morning. So thank you so much for those opportunities to hear those country experiences. They really, really enrich, I think, some of the principles and the principles that I discussed. there was, I think, 4 areas that came out to me. One was this issue of the private sector. So I think it's really, really important to remember that when we're talking about the private sector, we're talking both about private money and about private providers. And so to think, and I also really appreciated Undersecretary Fong's appreciation of the fact that there are certain roles that are really well suited to private sector involvement. And I think by admission also some roles where it's more difficult to deploy private money or private facilities into the public interest. So thinking about what are the mechanisms for doing so, what are the safeguards, and also what are the capacities that governments need to be able to manage that private sector, because they are very, very important. And throughout the region, that both the opportunities to mobilize private finance, but also the need to manage private sector delivery, particularly in urban areas. And I think we haven't talked really about urban health, but I think that's a major challenge. So that was the first point. The second one was really this whole set of issues around the changing burden of disease, the effects on population health of aging and non-communicable diseases. All of these things will benefit from a PHC approach, but it requires a new PHC approach. So thinking about how do we create new models of care that harness the expertise of different disciplines to really have an approach to primary health care that is focused on the healthy lifestyles that we heard the minister from Palau speak about, but also allow for better integration. So that's integration across disciplines, bringing together your mental health and physical health, or whether that's also about integrating between the primary care system and higher levels of the system. And I think that financing instruments have tremendous potential to help manage that and to drive new ways of delivering care that we can use for the benefit of our populations. The third point is this whole idea about money, and I really appreciate both that money is never enough, that we need to spend more but spend it better, but also that not all problems are financial problems. They're not all problems about spending, and that linked to something that we didn't really talk about very much was the issues of quality of care. So we heard about some of the tremendous achievements in terms of coverage, and also of service accessibility and equity. But I think that challenge of quality of care is there, and that's not always driven by financing mechanisms. That requires other types of policy levers. And we heard about some of these and the creative ways that national governments are taking to respond to challenges of retention and motivation of staff, and to things like the quality of management in the public sector, which really is needed to be able to improve quality of care, so that all of this service delivery that we are focusing on can produce the benefits and the benefits in terms of population health, but also the benefits for what that means for improved economic performance in the region. So I'll stop there, but thank you so much for the opportunity to share with you the Lancet Commission results and to reflect on the broader experience in the region. I found it a very rich and informative discussion.
Thank you very much again for waking up very early in the morning and being with us, sharing your wisdom and experience with the Commission. Just I think that your point of keeping the public policy goals above everything, and I think that's a critical. And the last one, how financing alone will not do the trick, and it's really a need to put it together with other policy levers. Very important points. So we are going to close the panel, and I want to give 1 minute to each of the 3 panelists if there is a reflection or a message to pass. Let me start with Honorable Minister Uger Belao.
Thank you. Just want to thank you for the panel, for the opportunity to speak. I think just as a parting thought, we need to plan with the future in mind. I think we need to realize that our words and actions today will be tomorrow's reality. And that means, following trends, making sure that our decisions are data-driven, that we anticipate challenges along the way, And I think it also requires political will that was mentioned in the video, and the RD elect gave us a stark reminder yesterday that no matter what we do, there's always another level that we need to convince. And I think that's part of our responsibility is to move out of our comfort zone, outside of our health bubble, and really try to pull in the necessary partners and stakeholders to work with us to achieve what we need to do. Thank you.
Thank you very much, Honorable Minister. Datur Nur Hayati, please.
Thank you very much. I would like to highlight on 3 points. One, thankfully, because in the recent budget announcement for 2024, we have seen an increase in MOH allocation. But we do understand that health reform effort does not only look at just government funding, but also from other stakeholders, including the public-private partnerships. And we have actually many experience where we have actually collaborated with private sectors such as COVID-19 vaccination program, the Malini medical scheme, we have PKB40 and many others. The second point is spending on health is an investment. It's not an expenditure. Because we need this investment for us to have a higher quality, equitable, accessible, sustainable, and resilient healthcare system. The third point is to shift from curative care to health and wellness care. The whole government, whole of society, in which health in all policies are very important. We need to have a shared responsibilities across all sectors and stakeholders, including the community level. Thank you very much.
Thank you again, Datuk Nur Hayati. Last one, the Philippines Finance View.
Thank you. Again, thank you for inviting me here, and thank you everyone. I've learned as much from you. So I think my final point is just that public service, of course, is still the priority. We plan to strengthen universal healthcare. Just like to make the point that we don't see private sector as an enemy. So we're looking at private sector as a partner where they can be partners. And as I previously mentioned, PPP in the social PPPs or PPPs in the healthcare sector is very new. It's evolving. I'd like to make this appeal to WHO and to the rest of you that we are open to exchange of ideas, assistance, whether in expertise, knowledge, to how to do this, like innovative financing for delivery of public healthcare. Thank you very much.
Thank you again, Yusek Fong, and I'm sure that all here are for progress towards universal health coverage. And if this is the goal, we are in the right place. So sorry, we are running out of time. It has been a very stimulating discussion. I would like to thank you all the speakers, and I hand it back to Dr. Jacob for her final remarks.
Thank you. Thank you very much. And first of all, big thanks to the panelists for the excellent and the rich discussion. And equally my deepest gratitude to all the member states for the continued commitment to prioritize health and to utilize effective health financing strategies and mechanisms to facilitate progress towards universal health coverage. But as we heard and as we discussed, although progress has been good, we now have to accelerate the efforts and enact ambitious investments and health financing reforms to reach the UHC and also the SDGs by the deadline. And this needs really an acceleration. And that was also the point we heard in the UN General Assembly when they discussed the SDG implementation. So on the health financing, in my view, a new regional action framework may help to support the member states in taking the steps to build sustainable, responsive and resilient health systems for a healthier and safer region for the future. And therefore, when we discuss the agenda of the next regional committee, this is one of the topics that we will suggest. So thank you very much, and back to you, Chair.
Thank you very much, Dr. Jacob and Mr. Vinal Torres and all the panelists. Now it's time for coffee break. We resume in 15 minutes. Thank you. Respected delegates, we will now resume our consideration of agenda item 16. First, we will consider item 16.6, Rules of Procedure of the Regional Committee for the Western Pacific. If time permits, we will then consider item 16.4, Transformation of the Regional Office, including organization and workplace culture change. May I call on Dr. Susanna Jacob, Acting Regional Director, to introduce item 16.6. Susanna.
Thank you very much, Chairperson, distinguished representatives. As you may recall, last year during the session of the Regional Committee, several member states proposed that the rules of procedure of the Regional Committee be revisited. There were several key areas identified by the member states as needing review. They included the procedures for managing the region's work during the unexpected absence of the regional director and ensuring timely and effective channels of communication with the member states. They also included a call to rewrite the rules of procedure in a gender-neutral language. Member states and the Secretariat further discussed these ideas during our morning briefings on the sidelines of the 76th World Health Assembly, as you may recall. Since then, the Secretariat has worked closely with the member states of the region to review the rules of procedure and develop a series of proposed draft amendments and a draft governance reform decision. Member states were invited to provide comments on the proposed amendments through note verbals from the Secretariat sent on the 21st of July, 4th of October, and 13th of October this year. The feedback the Secretariat received from the member states through each of these rounds were thoughtful and carefully considered. During this process, we took the opportunity to compare the region's rules of procedures to those of the World Health Assembly and other WHO regional committees. The Western Pacific region's rules of procedure were last amended in 2012, and the needs of the regional committee have since evolved. Through this exercise, best practices were identified and further proposed amendments were developed to meet the needs of the regional committee today. I would like to give the floor now to the WHO Legal Counsel, Dr. Derek Walton, to describe in more details the process we went through and the draft proposed governance reform decision and amendments we are considering today. Thank you, and over to you, Derek, with the permission of the chair.
Thank you. Thank you, Chair. Thank you, Susanna. And thank you for the promotion to doctor as well. I appreciate that.
I always make that mistake, sorry.
Good afternoon, everybody. After all the excitement of yesterday's election, it may seem a little mundane to talk about amendments to the rules of procedure. And I'm sorry to say there are rather a lot of them. But the good news is that there have been extensive consultations on these. So I'm hoping that there will be no surprises. And so what I propose to do is fairly quickly run through the amendments that are proposed, and obviously I'd be happy to expand on any in questions if you'd require more information. So there are two documents that you need to be aware of. The first is the proposed amendments to the rules of procedure themselves, and if you haven't already found them, these are annexed to document 10 in the document pack. And there's also a draft decision on governance that we'll come to a little later, which is what formally adopts the changes. Next slide, please. The first group of amendments deal with the conduct of business of the regional committee, and these are basically all designed to make work run a little bit more smoothly and to increase efficiency. So the first one is a particular favorite of mine, the electronic acceptance of credentials. You may remember on Monday morning there was a lot of running around trying to chase you all for the original versions of the credentials that you needed to bring from capitals.
if you adopt these changes, you won't need to do that next year. You'll only have to upload them on PDF, and we can save a little bit of time on Monday morning. Secondly, the vice chair, there's provision for a vice chairman ad interim or chairperson ad interim to be appointed. And this is because there are only two officers in the region, the chair and the vice chair, and it's not inconceivable that both may be unavailable to chair a meeting. So we're now providing for you to have the possibility to elect what is in effect a temporary additional vice chair for that purpose. Third change relates to the possibility of consultations. This is intersessional consultations with the chairperson, and in his absence or her absence, the vice chairperson. And there's also further provision to allow, if both are unavailable, for information to be shared with the regional committee members as a whole. And this is in part to address the situation that arose last year when the DG wanted to consult and there was no acting chair. We've made some changes, or we were proposing to make some changes to make it easier to call a special session. It's quite unusual in that this region requires currently a majority of members to formally request a special session in writing. Most of the other regions have a lower threshold, and we are proposing to lower the threshold here to 10, so that 10 of you can collectively request a special session, and also to shorten the time frame to 30 days in line with the normal practice throughout the organization. There's also a proposal to slightly adjust the quorum for the meetings, and that is currently it's a majority of the members. We're proposing, again, in line with what takes place in other regions, but it should be a majority of the members who are present at the session. So we wouldn't count those who haven't registered for the regional committee in future when deciding the quorum. The next point is actually quite significant in theory, although I think in practice it doesn't make too much change, although we can hear more about that later if needed, but it's to add Chinese as a new working language of the regional committee. This region, I think, is unique in having a distinction between working languages and official languages, certainly amongst the regional committees. The proposal is to effectively do away with that distinction. You currently have English and French as your working languages and Chinese, English and French as the official languages. This would simply make Chinese, English and French working and official languages. And then the final amendment under this heading is to make provision for electronic voting for recorded and in fact also for unrecorded votes. So this doesn't require you to take votes in future electronically, but it does change the rules to allow it to happen if you have an appropriate system available. So if the Secretariat is able to find a system and you want to use one, then you have the possibility to do so. The rules will allow you to do that. For what we currently have as a show of hands vote or a roll call vote, it's not proposed to provide for electronic voting for secret ballots. Next slide, please. There's also quite a big change to the way that non-state actors would interact with the regional committee. And this is to take account of FENSA. The rules of procedure still refer to FENSA's predecessor. So we're proposing to have an express reference to FENSA, which is the framework on engagement with non-state actors. And there will be two ways that non-state actors can attend as observers regional committee meetings. The first is those who are in official relations under FENSA will be allowed to attend automatically as observers without the right to vote. But in addition, there's provision for you to accredit additional NGOs, business associations, and philanthropic organizations which aren't in official relations under FENSA. They will be able in future to apply to be accredited as observers without a vote anyway. But there's also provision, and this is in the decision rather than in the changes to the rules of procedure. There's provision for a transitional arrangement because you don't yet have a system of accreditation for non-state actors who aren't in official relations. So one will need to be developed. And while that's being developed, the proposal is that non-state actors who attended this meeting will be allowed to attend next year's meeting too. Next slide, please. You may have thought the nomination process for Director General was flawless yesterday, but however, there were a couple of changes we would like to make. These are simply points to clarify a few issues. There's a proposal that we refer to the Code of Conduct of the nomination of the Regional Director. It doesn't have any real status in the rules at the moment, so an express reference would, we think, be helpful. It's proposed to clarify the procedure will follow if the number of candidates is reduced to 2 and there is a tie. Thankfully, that didn't happen yesterday, but it gets a little complicated, as you can imagine, if it does. And the paragraph at the moment is a little bit confusing. I'll come back to it in a moment. And then the other points, the next 2 points are really just to clarify things which already happen in practice, but which it would be useful to put in the rules. And that is that the announcement of results obviously takes place at a public meeting, and that the term of appointment of the regional director will be 5 years. And then the last point again arises really out of what happened last year, and it's making provision for an acting regional director. And this will allow, well, the first thing to say is that it remains the committee's prerogative to provide for the successor regional director in the case where that is required. But where a regional director is unable to act, the proposal is to give the Director General the power to make an appointment, make a designation for an acting regional director to make that power explicit. Next slide, please. There is a correction to the text that is attached to Annex 10 that I would like to bring to your attention, and that's in the paragraph in Rule 51. And this is the paragraph dealing with the procedure that we will follow if there is a tie between 2 candidates, or the last 2 candidates in the election. And that's simply at the end, in the last sentence, you'll see that it says, in the event of a tie after the 3rd such ballot, the whole voting procedure established by this, it currently says rule, shall be recommenced based on the short list of candidates. The current text refers to this paragraph, and I think it should stay this paragraph. If we change paragraph to rule, as is in the current draft of the rules of procedure, then you could have to go back to the beginning of the process with the shortlisted candidates, which would include interviewing them again. And I don't think in a case of a tie, we would want to interview candidates again. All we're doing is we go back to the point where there are 5 candidates who've been shortlisted, and the process would start again from there. But if we change rule to paragraph, we wouldn't have to interview them again. Next slide, please. There are a number of procedural matters. These really are clarifications and providing a little more detail to a few procedural issues. Voting only on, I mean, the first 3 really are quite minor. I won't go into detail on those, but if you have any questions, please ask me, and I'd be happy to elaborate later. The last 2 I will just mention, and that is we're proposing a change on what you do if there's more than one proposal that being put forward under an agenda item. Most other regions and the headquarters governing bodies or the global governing bodies all would treat this by dealing with the proposals in the order in which they were circulated to member states. You're alone amongst the regional committees in doing something different, which is at the moment provides for the proposals to be looked at in the order in which they are furthest away in substance from the first proposal, which can be a little bit complicated to administer and requires the chair to make a judgment. It's perhaps more simple to follow the rule that we use the rest of the organization, which is simply to vote on proposals in the order in which they are submitted. There's a proposal also to require 48 hours notice of any proposal to suspend the rules of procedure, which is slightly ironic since you're going to have to suspend the rules of procedure to adopt these amendments to the rules of procedure, because normally you require a committee to have looked at it. And in this case, you've had extensive consultations that we've talked about. But in future, there would need to be 48 hours notice of a proposal to suspend the rules of procedure. Next slide, please. And yes, there are some editorial amendments just to make it read a little bit more easily. So we've been a bit more consistent in the use of terms. Rather than calling the regional director the director, which is what the rules of procedure do, nobody calls the regional director the director, as far as I'm aware. So we're trying to follow the real practice and say regional director. And there are a few other just clarifications and tidying up of the text from an editorial perspective. And then also, as you've heard, we are switching to gender neutral language. Unfortunately, this is only being done in the English version of the text, and that's because for the other official languages, it's difficult to make the changes to provide for gender neutral language without the text becoming very difficult to read. We came across this problem when we moved to gender neutral language for the rules of procedure and for the global governing bodies, and the solution that was used there was to adopt the gender neutral language in English because we could, but to follow the UN practice for the other languages, which is to remain one gender and have an express provision that the of a one gender includes the reference to the other gender unless otherwise expressly stated in the text. And we are making that proposal here, but there's a similar statement that would go into the decision that accompanies the amendments. Next slide, please. So those are the actual amendments to a text. As I said, there's also a draft decision that you will be invited to adopt shortly. In addition to making those amendments, it does a number of things on governance which wouldn't normally go into rules of procedure, but which also it's useful to record. The first is to request for regional director to hold consultative meetings with the regional committee's officers and the EB members from the region on a frequent basis. That already happens, but this will give it a bit more of a statutory basis, if you like. And likewise, and again, this already happens in practice, but this provides for it in a decision, is for the regional director to provide regular briefings to the region in the margins of both the executive board and the health assembly sessions. And then finally, and we'll be doing this a little later today, there's a proposal to formalize but also make some slight adjustments to the caucus. And this is the meeting that happens every year. We'll be doing, as I say, later this afternoon, where most of the members meet together to discuss the question of elective posts for the coming year, normally things like EB membership and the like. And that's actually has no formal status at all. The proposal is to give it a formal status. It would become a private session during the regional committee meeting, and there would be provision for the proposals which come out of it to be formally announced at a public meeting, a little bit like we did yesterday, where we have the private meeting and then we have the public meeting afterwards to give results. So that's the proposal. It would mean that the rules of procedure would then apply to that meeting. At the moment they don't, which would, I guess, give you the option to vote if you wanted to eventually. But it would be a private meeting, so only member states would be entitled to attend. Next slide, please. And then in addition, we have the adoption of amendments to the rules of procedure, of course, in the decision. They will come into force once this meeting closes. So on Friday, at the end of the session, the new set of rules of procedure would come into effect. as I say, there's a paragraph recording the understanding about the use of one gender in the non-English versions of the rules. There is also the provision on transitional arrangements for non-state actors, it should be not rather than non, I'm afraid, on the slide, in official relations with WHO. And also you ask the Secretariat to renumber the rules of procedure at an appropriate time. And that appropriate time may not be immediately after the rules are amended this year, because we're anticipating there may be a need for further amendments to the rules of procedure next year. I did mention the nomination process for the RD. Well, there's a proposal to discuss that informally at the Executive Board's retreat in December, and it may well be on the agenda for the Executive Board meeting in January. And it's quite possible that there could be further ideas and proposals coming out of that, which you may want to consider and incorporate within your own rules of procedure. So it would probably make sense for us to wait until after we're clear whether there's going to be further changes to the process for the RD nomination. And while I have the floor on that, perhaps since we went through that process yesterday, it might be a good idea just to take a note of any improvements that you do feel could be made and perhaps feed them into that process in January at the Executive Board, if that seems an appropriate thing for you to do. And I think that's the end of my slide presentation. So I will hand back to you, Chair. Thank you very much.
Thank you very much to our legal counsel. We will now hear from representatives who wish to speak on this item. Please indicate you wish to speak by clicking the big button on your microphone. Lovely. Excellent. I see there are none, so I pass it back to the Secretariat. Oh, sorry. Yeah. I call on the representatives of the United States, followed by China.
Thanks, Mr. Chair. I was trying not to be first. So, thanks, Mr. Chair. My delegation wanted to intervene on this agenda item to really appreciate the work undertaken by the Secretariat on this topic, as well as the engagement of other member states to update and improve the WIPRA rules of procedure. I think for us, we believe the proposed amendments work well to achieve the expressed goals of member states, including, still not close enough, thank you, including last year at RC 73, as well as the Secretariat's goals. We welcomed the opportunity to provide our suggested edits to help improve the document in an effort to modernize it, harmonize it with those of other regional committees and WHO bodies, and address gaps that member states have observed. For my delegation, we're comfortable with the updated package of rules as presented in document WPR/RC 74/10, and we welcome the adoption of the updated rules at this meeting. Thank you, Mr. Chair.
Thank you. Now I call on representatives of China.
Thank you, Mr. Chair. Similar like the US delegation, China didn't want to be the first to intervene. China appreciates the Secretariat's report on the rules of the procedure and the efforts carried out. And also we thank legal counsel for his very comprehensive and informative report. China appreciates the proposal of having Chinese as a working language. China believes this reflects the efforts by our acting regional director, Dr. Susanna, and the regional office in implementing resolution WHA 71.15 on multilingual working environment. It will enable all parties to share their experiences on health development, thus making greater contribution to the early realization of health-related SDG. China supports the revision on gender-neutral language. Regarding the amendments to the regular communication among the regional director, the regional members of the executive board, and the regional committee officers, China supports the regional efforts to enhance coordination on key focus of work. China also believes that to avoid incurring extra physical cost and burden of workload, the region should make optimal use of other governing body meetings for communication and coordination. China also notes similar concerns are raised by other countries, and we commend Secretariat's positive response. With regards to the procedures of recommending members of the executive board and conference officers, China supports the practice of holding private meetings during the RCM. We also believe the Secretariat and regional director should carry on traditions of active coordination among all parties prior to the RCM to improve the efficiency of decision-making in our private meetings. Thank you, Mr. Chair.
Any more representatives who wish to speak on this topic? If not, may I now call the Secretary to respond to the points that have been made?
Okay, thank you, thank you very much, Chair. So first of all, thank you for this initiative last year at the Regional Committee, and also for your patience with us during the 3 rounds of consultation on the peak of the summer, and apologies for the short deadlines that we have always provided, and thank you very much for your input. And also thank you very much for your support to these amendments. As our legal counsel highlighted, I think it would be a good idea to have if you have any reflections on the nomination process for the regional director from yesterday and also from the previous time, it would be good to get that feedback from you. And then, as you also pointed out, the EB retreat will also discuss the nomination and elections of the regional directors. I would be surprised if they did not give strong support to the candidates forums, for example. So maybe we should consider also to include this then if there are any changes coming from the EB retreat into our rules of procedure. So I think maybe we should wait a bit, but this package is supported by the regional committee, and thank you to everybody. Any further comments? No.
No, I don't think
No.
so.
Okay. Back to you, Chair.
Thank you. Thank you, Dr. Jacob and Mr. Walton. Distinguished delegates, as it was explained by the legal counsel, the draft decision entitled Governance Reform, including the proposed amendments to the rules of procedure of the regional committee, were the subject of extensive consultations in the run-up to this regional committee session. I will now ask the Secretariat to display the draft decision on screen. The decision reads as follows. Decision WPR/RC74 in bracket X, Governance Reform. The Regional Committee, having considered the report of the Secretariat regarding governance reform contained in the document WPR/RC74/11, decided that 1. In order to facilitate the work of the Regional Committee, including matters that involve preparations for sessions or that arise between sessions, the Regional Director shall, as required, convene consultative meeting with officers of the Regional Committee and Western Pacific members of the Executive Board, and that the outcomes from such meetings shall be circulated to the members of the Western Pacific region. 2. The Regional Director shall provide regular briefings to the members of the Western Pacific region on important developments related to the Regional Office for the Western Pacific on the sidelines of sessions of the Executive Board and World Health Assembly, as well as at other opportunities that may arise. 3. Members of the Western Pacific region shall meet in private during the session of the Regional Committee to discuss proposals for the elective posts, with the agreed proposals then announced at public meeting. Amendments to its rules of procedure contained in Annex 6 to document WPR/RC74/10 in accordance with Rule 53 of the Rules of Procedure of the Regional Committee for the Western Pacific shall be adopted. And 5, amendments in order to replace or supplement gender-specific language shall be in English only, and that the United Nations practice shall be followed for the other official and working languages of the Regional Committee. 6, in the non-English language versions of the Rules of Procedure, in accordance with generally accepted rules of interpretation, the use of one gender shall be considered as including a reference to the other unless the context otherwise requires. 7, the foregoing amendments to the Rules of Procedure shall become effective upon the closure of the 74th session of the Regional Committee. 8, pending the adoption of the Regional Committee of an accreditation procedure in accordance with paragraph 57 of WHO Framework of Engagement with non-state actors, only international, regional, and national non-state actors not in official relations with WHO that have already been invited to regional committee sessions may continue to be invited to future sessions of the regional committee pursuant to Rule 2 of the Rules of Procedure as amended. And the Secretariat shall renumber the Rules of Procedure of the Regional Committee for the Western Pacific at an appropriate time, taking into account the amendments adopted through this decision. May I take it that the Regional Committee is ready to adopt the draft decision that I just read out with the amendment proposed by the Legal Counsel to Rule 51 of the Rules of Procedure? I see no objections. The decision is adopted. We will now consider item 16.4, transformation of the regional office, including organization and workplace culture change. I call on Acting Regional Director, Dr. Jacob, to introduce this item.
Thank you very much, Mr. Chairperson, distinguished representatives. The WHO's transformation approach focuses on creating a modern WHO that works seamlessly to make a measurable difference in people's health at the country level. This approach includes the strategic objective of enabling the full potential of our organization. To this end, the Western Pacific region collectively has embarked on a process to strengthen and improve its impact and organizational efficiency and balance impact with compliance. At the same time, we have improved our workplace culture to enhance our ability to serve all of you, the countries and areas of the Western Pacific region. Work is underway in several areas to make sure we accomplish these goals. In so many ways, we have come together to drive positive change across the region to make the WHO regional office and country offices safer and more respectful workplaces. And as you all know, a happy workforce goes a long way in enabling WHO to better support member states to deliver more impactful results on the ground. To improve impact, we have taken several initiatives. First, in line with the Director General's focus on results and accountability, we became the first WHO region to sign the new delegation of authority to the WRC in May. This change will give WHO representatives in the region the decision-making power they need to be more agile and responsive to country needs and priorities. To support this increased authority, 3 multi-country hubs are being established to strengthen capacities at the country level in human resources management, finance, compliance, and risk management. We also put into effect a new delegation of authority for technical directors in the regional office. They now have more control over their activities, handling many responsibilities that used to be under the Director of Program Management. At the same time, we abolished some burdensome committees to free up time for other priorities and lighten the workload. To make sure that this process improves impact and result incrementally, we started a new way of planning for the next biennium so that WHO's work plans will be focused on country needs and priorities from inception through implementation. At the same time, we reviewed internal processes with an eye towards reducing the burden on staff. Efficiency and impact have driven the redesign of 3 priority processes: human resources, recruitment, program management, and publication. This collaborative effort involving 131 staff members has kick-started a transformative phase. This process also includes a review of the roles and responsibilities of the staff to update post descriptions and balance the work of P and G staff, professional and general service staff. The many recommendations received have led to the establishment of a change management group to guide the regional director in implementing these changes. The 100-day implementation drive will ensure that momentum will not be lost in fast-tracking key changes for transformations. More medium and long-term plans will be discussed with the new incoming regional director. The management action plan includes 2 components. One, to strengthen country capacity through the Action for Result Group initiative. This is the DG's initiative globally to drive the strengthened capacity in the country offices. And the other on change management to improve culture and behavior to ensure impact and efficiency. Regarding cultural and behavioral change, the Western Pacific region aligns with WHO's core values and global efforts to create respectful workplaces. This work is guided by several key policies, including the WHO Values Charter, the Code of Ethics and Code of Conduct, as well as the zero tolerance policies for all forms of abusive behavior. Significant training and capacity building has already been done in this area, including informing all staff about systems and processes in place to report wrongdoing. Initiatives by our Human Resources Unit for team diversity, safety, and staff well-being underscore this commitment, along with training and development to foster a more supportive work culture. The Office of the Regional Ombudsperson continues to work with our workforce, providing support to resolve work-related issues through informal means in an independent, confidential, and neutral manner. In its first year, the program handled 141 cases, focusing on supervisor-supervisee relations and systemic issues. Personal connections were also established through visits to country offices. The Ombudsperson has also advised on issues related to burnout and work-life balance. A focus going forward will be on building psychologically safe teams and fostering a speak-up culture through a train-the-trainer model. In line with the WHO zero tolerance policy, we have been working on a range of activities aimed at preventing sexual misconduct throughout the organization and the region. WHO's commitment is unwavering. Region-specific initiatives and country office visits have already helped foster collective responsibility, as these discussions help create safe spaces. Already, the increase in cases reported indicates growing confidence in reporting mechanisms. Realizing the 2030 vision for PERCH, prevention and response to sexual exploitation, abuse, and harassment will involve the development of a regional action plan and engagement with other United Nations agencies. Other steps taken include the formation of a workplace culture task team to focus on providing support and tools to enhance team building and work-life balance, with the aim of colleagues co-creating a stronger and more inclusive workplace culture. Capacity building activities target both senior management and staff in general, addressing values in action, cultural competency, and inclusive leadership. Ongoing monitoring and evaluation strategies, such as surveys and focus group discussions, have revealed positive changes, but also highlight persistent issues, prompting further listening sessions and recommendations. The most significant change methodology complements these surveys and discussions by showcasing impactful stories about empowerment, work-life balance, and capacity building. This approach guides the data-driven journey towards a more respectful and supportive workplace culture in the region. Mr. Chair and representatives, this is just a short update. More details on these activities are found in our document RC74 INVDOC 2, Transformation of the Regional Office, including Organization and Workplace Culture Change. In addition, we were presenting to you a detailed update on WHO's ongoing transformation efforts in the lunch break with the involvement of some of our staff. We will focus on the Western Pacific region's initiatives to prevent sexual misconduct, strengthen our workplace, and enhance our organizational culture. WHO in the Western Pacific region is committed to continuing activities that contribute to creating a workplace that all workforce members can be proud of and where all supported to do their best work for the countries and areas of the region. We all know that organizational and cultural changes, including efforts to prevent sexual misconduct, are complex and take time. The good news is that we are already seeing positive impacts from these ongoing efforts. Again, I would like to thank Member States for your continued support of WHO and its workforce in the Western Pacific region. Thank you, Chairman, and back to you.
Thank you, Dr. Jacob. We will now hear from representatives who wish to speak on this matter. Please indicate your wish to speak by clicking the big button on the microphone. No one wants to be the first. I call on a representative from Australia.
Thank you very much, Chairperson. So yes, thank you very much, Acting Regional Director, for your briefing and reporting on this key issue. Australia welcomes the positive developments that have been reported to us under the WHO Transformation Initiative at the regional level. We're very pleased to see progress towards more sustainable resourcing of WHO country offices as well as the devolution of functions and accountability. We also appreciate the very useful presentation on progress at the side event at lunchtime. Thank you for that. Prioritisation of staff health and wellbeing is essential. It's great to see the focus on these issues in WHO's work to build respectful workplaces. To turn to the issue of preventing and responding to sexual abuse and harassment, PRCR, leadership is fundamental on issues of sexual abuse and harassment. We were pleased to hear from the acting RD as well as from the Director General earlier this week, stressing the importance of WHO policies in these areas. And we encourage continued messaging on WHO's approach to these issues from WHO and WIPRO senior management. We're encouraged by the efforts of the PRCR Management Officer and Focal Point Network, and we'd be interested in updates on progress of the PRCR country action plans. Australia commends WIPRO for developing information documents on responding to incidents of sexual misconduct that are trauma-informed and supported by culturally appropriate toolkits. We also appreciate the update on the activities of the Regional Ombudsperson. We're interested in further information on the systemic issues that were identified in the course of the Regional Ombudsperson's case management. We do remain concerned by harassment and abusive conduct reports, and we'd be interested in updated statistics and information on disciplinary action taken, given WHO's zero tolerance approach. Transparency and accountability is key to encourage victims to come forward. And we encourage WHO to proactively address issues where there are patterns in allegations. We were encouraged by the Workplace Culture Task Team's efforts to roll out values in action dialogues and to listen and respond to the workforce. We congratulate the team on the region's 2022 Respectful Workplace Advocate Award and look forward to continuing progress on this agenda over the coming year under the leadership of the incoming RD. Thank you.
Thank you. I call on the representative of the United States of America to be followed by Philippines.
Thank you, Mr. Chair. The United States thanks the acting regional director for this report and for the demonstrated focus that the regional office has placed on building a respectful, accountable, and positive workplace. We wholly share the sentiment of this report that a safe and respectful working environment is critical for the organization to deliver on its mission of providing health for all in the Western Pacific. Among the many important activities underway in this regard, we especially support the regional office's efforts to align its activities with WHO global initiatives designed to ensure the highest standards of conduct and zero tolerance towards abusive behavior, sexual misconduct, and fraud and corruption. We further appreciate the Western Pacific region's focus on enhancing its recruitment and selection processes by aligning its human resource practices with WHO's Global Diversity, Equity, and Inclusion Initiative. The United States also appreciates the regional office's efforts to listen to its workforce through such means as targeted surveys, qualitative evaluation strategies, and focus group discussions. And we were pleased to hear more about some of those activities during the lunchtime briefing. However, we noted that findings from those initial listening activities have revealed some persistent concerning issues, including an unacceptably high prevalence of harassment or abusive conduct, as well as inadequate levels of confidence in senior management handling of bullying and harassment, and in the regional office's processes and systems for reporting and responding to misconduct. We therefore strongly encourage the regional office leadership And we welcome the regional director-elect's express a commitment to build on the acting RD's work on this important topic and to further advance the organization's efforts to improve its policies, processes, and culture as may be necessary to ensure a respectful workplace for all regional office personnel. And we look forward to supporting the RD-elect in these efforts once he takes office early next year. Thank you, Mr. Chair.
Thank you. I now call on the representative of Philippines.
Thank you, Chair. This is the combined intervention on Agenda 16.4 and 16.6. The Philippines underscores that emphasizing culture management and risk management as complementary will bolster collective accountability within the organization. From the unprecedented events that happened in the WHO family in the Western Pacific, we arise together blessed with the wisdom to update rules and procedures to ensure that management can detect and respond to risks threatening the organization's performance and prevent disruption of important functions of the Secretariat and the governing bodies. We thus appreciate the draft governance reform decision and amendments to the rules of procedure that was circulated to member states. The region is indeed fortunate to have the Deputy Director General as acting regional director, with her excellent leadership role that ensured the continuity of the WHO operations in the Western Pacific. It is high time to institutionalize a governance mechanism to put in place in the event of similar events. We also recommend more focus on timely and effective channels of communication with member states that are from the Pacific Island groups so that we continue to ensure sufficient support to governments and populations in the remote islands in the Pacific. A more gender-neutral language in the rules of procedure is a strong message that the regional office has zero tolerance for discrimination, has utmost respect for every person, regardless of gender, and cultivates a risk-sensitive culture. A strong workplace and organization culture also need investments for informal channels, for impartial, independent, and confidential advice, assistance and support on workplace grievances. Finally, the Philippines looks forward to closely working with the Secretariat for a new country cooperation strategy that reflects the new ways of working to accelerate measurable impact in WH work in the country. It should serve as a framework that will guide both the Secretariat and the government in working effectively and efficiently together in bottom-up planning and prioritization that is focused on driving impact in every area, as well as enabling WHO work across sectors effectively. Thank you, Chair.
Thank you. Are there any more representatives who wish to speak on this topic? If not, may I now call on the Secretariat to respond to the points that have been made.
As Chair, and thank you for the delegations for the support and the excellent comments. In our replies, please allow me to ask first Laura Davison, who is leading the work on cultural and behavioral change, to make comments, to be followed by Dakshini Gunaratne, who is leading the work on sexual misconduct, and then to be followed by your HR manager. Over to you, Laura.
Thanks, Susanna, and thank you to the member states for the really thoughtful interventions. This whole area of organization and culture change is complex. And as Susanna said, it takes time. So I appreciate the US's comments that we still do have some cases of harassment and bullying. That's true. I think that it would be wrong of us to deny it. But what we are seeing is that it's getting better. We are seeing evidence of that. And we're seeing through all of these various initiatives that we talked about in the side event earlier today and that Susanna listed here and that are outlined in detail in the document, that together across all of the streams, things are changing. We hear a lot about colleagues who are now comfortable to speak up when they see something that they don't think is appropriate. I hear that often That's often something people come and say to me. Small things, even like less emails on the weekends, or an apology for sending an email out of hours. Those tiny things, they didn't exist here before very commonly. And now they're a part of everyday life here. So it's complex and it takes time, but it's happening is what I would say. We are continuing to listen. We are continuing to learn, and we are continuing to act. And I do think we're getting better. But to continue to make sure that we're on the right track, we'll do another workplace survey later this year, which is a follow-up on the other 2 surveys that we've done previously. And I would say we're working really well together as a team across the many initiatives that really do make up this respectful workplace area. So if the chair allows, I'll pass over to Dakshini, our Presea Management Officer.
Perfect. Thank you, Laura. And I echo Laura's comments on the thoughtful comments, and it's really encouraging to hear member states talking about these issues. So thank you. To answer some of the questions raised by the Australian delegate, update on statistics. For the past 12 months, we've had from the Western Pacific region a total of 18 abusive conduct cases and 4 sexual misconduct cases. Now, while this may not seem like much, we must remember that for many years from Western Pacific region, the number of cases that went into formal investigations was 0. So this is actually something that shows, even a little bit of trust is building. While I don't have the number of cases on which disciplinary measures were taken for the Western Pacific region, globally in 2022 and 23, there were 11 cases where disciplinary actions were concluded. In terms of the update on action plans, so basically we started this initiative in June in asking country officers to have risk assessment discussions and action plans. Unlike the other most areas in other regions, what we did was we did a really serious exercise. So this took time for us to have these discussions, organize retreats that were 1 week, 2 week, etc. So as of now, we have 13 of our 16 country officers already having undertaken those risk assessment discussions. We've seen 7 countries submitting already either the risk assessment plan or the country action plans to us before we send it back to them and before they formally submit it. We've had 3 that has been formally submitted already. Either way, we expect all of this to come in by 15th of November. And again, what we prioritize here is what is feasible, what is context specific, what is culturally relevant. We ask people not to do something really standard that, it's an obligation, but rather what's relevant to them. And I really appreciate the question on, the comment on trauma-informed and culturally responsible responses. Wipro is the first region to develop trauma-sensitive workshops, trauma-informed referral systems. So whenever we have country office visits, we try to have trauma-guided workshops for the senior management, because one of the reasons that people are afraid to come forward on sexual harassment cases is they're worried that people won't believe them. They're worried about the response that their leadership may have. And this is why we as a region have prioritized this even before the globe has launched it. So that's one of our priorities. On improving policies and processes, as our colleague from the United States mentioned, this is also something that we as Wipro have taken as a priority. We understand the policies are there and these are really great policies, but the reality is they have to be translated onto the ground when it comes to implementation. And therefore, what we have done again is while liaising with the headquarters, we've become the first region to develop trauma-sensitive referrals related to standard operating procedures. Basically, we have now We're now developing standard operating procedures on how somebody can respond to a case of sexual misconduct that comes to them, how we can respond to a case of sexual misconduct that happens in an event. So again, our priority in the Western Pacific region is to make things as simple as possible to allow colleagues to come forward. And finally, I agree leadership is fundamental. And I think one of the reasons that we were able to be as inclusive as we possibly could was because our WHO country representatives were so receptive to the idea that we needed to have everybody around the table to have these discussions, that we could no longer silo between staff and non-staff. We've even had country offices where people had not met each other for 5, 6, 7 years, getting together on PRISIA retreats and talking openly about the types of things that they have witnessed or they had concerns. So I think, moving forward, it's incredibly important. As I said before in the side event, the leadership of the acting regional director was especially important in setting the tone for these kind of discussions and for giving the space for colleagues to have this discussion. And another one thing that I think is extremely successful, as somebody who receives sexual misconduct as well as workplace abuse cases, when colleagues come to me, one of the things that I find really helpful is also the acting regional director's open hours. That has actually been really successful for colleagues who have specific concerns to feel like they have been heard at the highest level. Thank you for that. Over to Rania.
So thank you very much to our member states for the comments. Human resources, we definitely champion zero tolerance. And I want to talk about a couple of, respond to a couple of comments made. We do value the speak up culture, but we do realize that other than speak up, many differences in how people react to workplace abuse exist. For example, during exit interviews with staff, I have a one-on-one meeting with every staff leaving the organization to sort of go through with them any issues they have gone. And we create a report and make sure that we feed back those comments back to the management team so that we can retool. It's very important to not only listen, but also to look at performance management reports, look at absenteeism, look at attrition. Those are all key indicators that HR looks beyond only the speak up and focus group cultures. Another thing we have done is that we have started this engagement 18 months ago with the staffing. For example, we realized a lot of consultants who are part of our workforce are valued. We're actually feeling that they wanted to be included and they wanted a voice and a seat with HR. So we started these quarterly calls where we engage with all consultants, all GS staff, all national officers. And this is their time. It's never recorded. It's a confidential session where they can raise issues, talk about some of the burning issues they're having in their management teams. And we can absolutely provide guidance. We also talked about how do we acknowledge bullying, harassment. We do acknowledge it will occur. And one of the reasons why we had the 1-week activities where we brought in the GMB, the Global Management Board, we brought in the legal team, and we brought in the Office of the Ombudsman, and HR and the Office of the RD championed this, was because we realized that staff members needed to know the transparent mechanism they had, independent of any of our officers, to absolutely report any forms of harassment, bullying. They don't need to come directly to HR. They can go immediately file an administrative review and it will be taken very seriously. And we also receive the reports. And what we do is we look at the disciplinary actions and we discuss them with the management team. And we make sure that we are very fit for purpose and mindful in some of that trends. The last thing I want to talk about was I absolutely agree that sustainable resourcing is needed because we have started a lot of great initiatives and it is working. It does take some time. So I implore on management and the incoming RD and the member states, and actually want to champion the statement that we should invest in all of these activities, because for change to be seen, even though it takes time, it has not to be one person doing it, it has to be the entire organization. HR is aware of incidents and we swiftly respond. We issue letters immediately. We hear of abusive conduct swiftly. We make sure we change and we escalate everything. I want to echo what Dakshini mentioned about the acting RD's open door hours, where she meets with any staff, any personnel at all levels and discusses with them any issues of abusive conduct or anything that is burning with the staff. Immediately she has that information, she cascades it to HR or any of the teams and management that should take action. I am very pleased that we're part of this transformation together, and I look forward to continuing some of these agenda items. Thank you.
Thank you, Rania. Arpit, final comment?
Yeah, thank you, Acting RD. Just wanted to draw the attention of all the member states in line with Director General's accountability. I think the dashboard that Internal Oversight Services has now set up on the WHO website. And I think this is also a very useful tool for all the member states to see on the number of cases that are opened since last month, number of cases that iOS has closed, and the cases that are open at any point of time on the sexual exploitation, sexual abuse, sexual harassment, and abusive conduct. And I think it also provides breakdown by the regional office, and it also has information on disciplinary measures that are taken on substantiated allegations from this initiative. So I think all of that information is available out there as well. So I just wanted to emphasize.
Thank you very much, Arpit. That's a very important piece of information for the member states. So thank you very much, member states, for all your comments and support. We are committed to pursue all these initiatives and activities, and we will definitely do so. This applies not only to the regional office, but to all the country offices, so to all the region, basically. Which is a message that I wanted to pass on to you. And we will do as much as we can now during the remaining 40 days or how much, 100 days up to the 1st of February, and then hand it over to the incoming RD. However, we are already going to engage the incoming RD with all these new initiatives so that he is on board, and we will discuss them with him starting already later on this week when he is available, and we will set a timetable on how we will involve him, brief him, and we will not take any initiatives now, important initiatives, of course, without his engagement and involvement. Thank you very much, and thanks for all your support.
Thank you again, Dr. Jacob and the team. If there are no further comments, the committee notes the transformation of the regional office, including organization and workplace culture change report. Thank you. We have now reached the end of today's session. We will reconvene tomorrow at 900 hours, Manila time. I would now like to invite the Acting Director of Administration and Finance, Mr. Arpit Agarwal, to remind us of the details.
Thank you, Mr. Chair. So just a couple of very quick announcements. One is immediately after the plenary session, a private informal consultation with member states, also known as the caucus, will be held in this plenary hall at 17:15 hours in 10 minutes from now. As you know, this caucus is attended by the chief representatives and up to one of the designated alternates of member states, with seats of government from the region, and addresses issues such as office bearers for the World Health Assembly and nomination of executive board members. So we would ask that all others vacate the hall immediately following adjournment of the plenary. And there will be transportation back to Manila and Sheraton Hotel at the end of the plenary session now, as well as after the closure of the caucus meeting as well. So with that, I hand it over back to you, Chair.
Thank you very much. And that's it, everyone. See you tomorrow.